Good afternoon, everyone. Good morning. Buenos días. Buenas tardes. Depende de donde estén en el mundo hoy. Hello, everyone. We're very excited to start the final pitch session of the Puerto Rico COVID Ideathon. So if you're joining us on a live stream and you don't know too much about us, we're a 48-hour virtual event for developing solutions to the problems that COVID-19 has brought upon or exacerbated, specifically in Puerto Rico. With over 100 applications, we had a huge interest from the Puerto Rican community to want to participate in this event. But it's not only participants that wanted to become involved in teams to develop and ideate. We also had a huge and very powerful involvement from the mentorship community in Puerto Rico. People involved in all walks of life that wanted to contribute to Puerto Rico's advancement and really recovery after many things that have happened in Puerto Rico, hurricanes, earthquakes, and now COVID. We also have the participation of 12 judges that are industry leaders in their field, which will be helping us and assisting in deliberating on the final prizes for the Ideathon. Participants represent 7 countries and territories to help that tiny island in the Caribbean, but are all united by a passion to help one another, to help Puerto Rico succeed and thrive as COVID-19 continues to ravage our island. The challenge for the Puerto Rico COVID Ideathon was for participants to join in teams and deliver a 5-minute pitch. In the pitch, they'll present their problem statement and analysis of the context. They present their solution. They'll be looking towards innovating the problem field throughout their solution. They'll also be they've been explicitly challenged to have a solution that's relevant to Puerto Rico. Teams joined in groups of 2 to 5 people. They worked throughout the weekend. They had some number of resources available to them. Namely, they had a business model canvas workshop. They had a how to pitch workshop, both delivered by industry leaders in the field. And they also have 2 practice pitch sessions with the Puerto Rico COVID Ideathon Planning Committee and mentors. You can see the Planning Committee on board. All of us have worked tirelessly throughout the past few months in order to bring this event to light. We're an independently organized group of young Puerto Rican professionals and students that are interested in making a difference for Puerto Rico. We didn't want to wait till COVID-19 was over to help get the island on track to its recovery. We also have the assistance of our track leads. These are amazing people that have taken their time from this long weekend to also help us out and deliberate and plan and manage throughout the Ideathon. So we're going pretty fast. So soon we'll start with the health track. The health track will be presenting their pitches. For the health track, we have the assistance of our esteemed judges. We have Oscar Misla, we have Edmari Guzman Velez, we have Jose Rodriguez Orengo, and we also have Irving Vega. Now, Carlos Guevara, track lead for the health track, will introduce the pitches for the health track.
Okay, hello everyone. So for those of you who don't know me, my name is Carlos Guevara. I'm a 3rd-year medical student at the Recinto Ciencias Médicas in Puerto Rico. And I wanted to thank the organizers for inviting me and trusting me with this responsibility of leading this health track and this innovative event. It was very inspiring to work with 8 groups composed of a total of 30 innovative people throughout this weekend. I want to thank you all for letting me be a part of this creative process. And I also wanted to congratulate all of you on your great job, because I've seen the progress you've made in such a short period of time. And without further ado, we can start with the first group, and good luck to everyone, and you should be proud of yourselves. So the first theme will be gravity.
May we start?
Yes, the timer will start when you guys start talking.
Good afternoon, everybody. Hope you guys are doing well. So for the Ideathon, we will be using a Track, which is an app for cell phones created by our team, Team Gravity. Next slide, please. So what is the big problem we face today? So as you know, Puerto Rico is facing myriad amount of problems. However, two of the most impactful ones are the lack of access to data regarding to the vaccine and the logistic of mass vaccination campaign. Next slide, please. So our group and I have come with different logistics in order to, next slide, please, in order to solve this issue. And we have the availability of information about the vaccine, which will be given through our app to the patients, and they will be informed in regards to where they can get vaccinated and how and where. Also, we will be giving them extra information about the side effects these vaccines may have. Then we have the difficulty tracking progress of vaccination campaign and due to the lack of efficiency and speed, which is basically informed in the newspaper above. Then we have gathering and organizing data on people who have been vaccinated. And finally, we have the collection of data from people who experience adverse symptoms or secondary effects after the vaccination for safety and efficacy improvement of services. Next slide, please.
So the solution that our group gives is our app VaxiTrack. Next slide, please. So the aim of our app is to facilitate the data recording and administration for vaccination campaign in order for it to be more efficient. This will be achieved through our app by implementing registration for vaccination and providing news about the pandemic. Additionally, any registration for minors will be done through their legal guardians. The app will use a patient's address to match them to the vaccination location nearest to them for their convenience, and their details about the vaccination will be shared with the patient via phone or email in order to avoid contact with the patients and others. The app will also allow recording of immunized people, their adverse effects, amount of doses, and infection after vaccination. Next slide, please.
Okay, so this is how VaxiTrack works. First, we lead to the starting page in which there will be a sign up, login, and about us. In the about us, we will answer frequently asked questions about the vaccine and about how the app works in general so that you have an easier way to navigate it. Next, we will have the sign up where we will sign you up with your name, your age, your social security number so that we can identify you, your address, and any other information we need for the registration of the vaccine. And we will also provide a waiver in which we will have your permission to use this information, but us ourselves will not be looking at this. So it will kind of remain anonymous in between us and the patient. Next, we have the main page where we will provide the news, profile, reports, and notifications. In the news, we have news about the pandemic, the vaccine, and anything else that's come out. In the profile, you will be able to see your profile and edit anything that you need to edit about it. In the reports, just like said in the previous slide, you will be able to report any cases in immunized individuals if you know of any adverse effects or any problems that you face in the app. And in the registration for the vaccine, you will be able to register with the vaccine through a form or survey in which you will be provided with a place where you can write any underlying conditions, profession, age, address, and any other information you need to match you up with the app. And you can also sign up to become a standby in case anyone misses their appointment so that they can call you up very quickly and you can go get vaccinated instead. And so in this next part, we have an example of the notification of your spot, which is kind of like a digital waiting room, in which this interactive map shows how many people have been vaccinated per region roughly. And it also shows your address and the address of the places nearest to you, in which you will be matched with. And in this case, there is a man who is in the second phase because he is a teacher, he's 50 years old, and he suffers from obesity. And it says that he will be vaccinated approximately in June 2021 and that this is subject to change. And so this just provides more efficiency towards the organization of data and the organization of people who want to get vaccinated. It's just a lot easier. Next slide, please.
So in order to reach herd immunity of 70%, people need to be vaccinated. This is going really slowly, especially with the statistics shown on the newspaper to the right. Reducing delays is important, and is so getting as much more organized system of mass vaccination and prioritization. This is why we need VaxiTrack. Since nothing like it has been implemented before, it is a new innovation solution from many angles. Even though COVID-19 is our concern and our priority, Right now, it will be later held as an app for more organized vaccination systems in general. It can be target the large population of Puerto Rico with the incentive to register easily for the vaccine. Since it is only online and a partnership with the Department of Health and Government, we estimate about 2 million people to join our based on the census when considering those that can use the tech to those who should be vaccinated by June. In the rate we are going,
We're at 5 minutes. Please
it can
conclude.
it can save Puerto Rico from losses of appointment and inventory problems, which is turn safety to the government of thousands of dollars. Thank you.
Okay, thank you, Gravity. Great presentation. You guys should be proud. The next group that will
We'll
be
be
present.
opening the,
Oh yeah, sorry. I'm sorry. That we will be opening the floor for questions from the judges.
I have a question for Gravity. This is Irving Vega. You mentioned that one of the items for identification is the social security number. That brings two important considerations. One, security, and two, immigrants that don't have social security. How you guys plan to deal with
Can you repeat your question? Because you were kind of talking in a low voice and I couldn't hear it that well.
Okay, perfect. So you mentioned that the identification will be based on social security number. That brings two important considerations. One, security, and two, immigrants that don't have social security numbers that also need to be vaccinated. How are you gonna deal with that issue?
Well, in the security portion, we will provide a waiver in the beginning that will allow us to use the information without us necessarily being able to see it. So it will continue to be anonymous and secure, but we will still be able to make sure that you are who you say you are, and that way it will make the registration of the vaccine easier. And so by immigrants that do not have a social security number, we have not really thought of that system yet, but maybe we would use another form of identification. Just the social security number only works to make sure that you are who you say you are. So with any other form of identification, it can probably work to just make sure you are who you are and you can get vaccinated as soon as possible.
May I please intervene quickly about the immigration status? I guess depending on the person and how they have their immigration status, if they do have a green card, they could take out a security number, but it is also possible that they give you an identification number, like the government gives you an identification number that serves as a way as like your security service number, but it's not the same as one. So that could be a possibility. And if they are unable to have an identification number because they are undocumented, they can contact a migration lawyer, and the lawyer can help us figure out a way to deal with their situation. So it would involve the third party, but it is very feasible to do.
Okay, we have a few questions also in the chat. Do you guys see them, or you want me to read them out loud? Okay. This is gonna be the last question. Do you see it, or do you want me to read it out loud?
I can see it. How are you going to work in the back end with the vaccination sites for the appointments? So can you rephrase that question? Because what does back end necessarily mean?
This is Dr. Jose Rodriguez. Is that you are going to be working with more than 400 sites? And how are you going to work with each one in the appointments? And what is the type of access that they will have, and how are they going to know when they have, because it's going to be very different for all the sites.
Well, we were thinking that each application, even though it's meant for the user, it can also have kind of a section for the vaccination sites that we are working with, so that they can, and through the Department of Health, that's why we are partnering with them, we can make this process a whole lot easier in terms of communication, because the Department of Health can provide us with the data that we need in order to correctly organize this, and can just make the communication with all the sites much, much easier. And so each of the sites in this kind of app, if they are using it, each of the sites will kind of have their section to update us on their capacity and on the supply that they have in order for us to be able to allocate the people a lot easier. And in case we run into any problems, in that case, we can just allocate the people somewhere else. And so that's why in the part of the notification of your spot, we said that it is subject to change as a disclaimer, because you never know the circumstances that you're going to encounter. And so the key player here is communication. I hope that answers your question.
Okay, perfect. Thank you, Gravity, for your presentation. Great one. Now we can go past into the next group, which will be the Cove hackers.
They can start whenever they want. Go ahead.
Good afternoon. Our team's name is Cove Hackers, and we're going to be presenting our solution. Next. The raw data provided to Health Department has poor integrity because the laboratory systems are not connected to the BioPortal API. Hence, COVID-19 test results are being inserted and validated by hand, allowing the data to become corrupted. Next. This causes other problems such as citizens not knowing the real impact of COVID on the island, tedious and expensive testing protocols, not inefficient use of resources, and government and media distrust. Next. Our solution creates a centralized system that manages all aspects of the citizen testing, consulting, and monitoring process. Next. Introducing PandAid, a large-scale infectious disease monitoring system. Next. Using the system alert user interface, citizens can report their symptoms, view test results statistics, and be exposed to vaccination and mask-wearing campaign ads. Next. Using the Health Guru user interfaces, health professionals can provide telemedicine services. Next. Via video consulting for a faster and safer service, it provides an easier way for health providers to bill e-visit services to insurance companies with virtual payment options. Next. The symptom alert relation to Health Guru is patient reports symptoms, doctor contacts patient, patient pays deductible and an extra 25% fee, doctor bills services to health insurance, and health insurance pays doctor for telecommunication services. Next. Clinics and labs can monitor available resources and share test results with health organizations using the clinic's UI. Next. Symptom alert in relation to clinics works similar to symptom alert to Health Guru. Next. Using Pandemic Monitor, you can show summarized data, display updated information, and help make more informed decisions. Next. Our market is primarily the government, especially the Department of Health, though our services can provide services to other types of customers. Next. These are a few of COVID-19 trackers in Puerto Rico. There's the Department of Health, COVID-19 in Puerto Rico. Next. And here are some of the COVID-19 trackers in the US. Notice that there are more trackers in the US than there is in Puerto Rico, meaning that there's still room in this market. Next. PandAid versus traditional COVID-19 trackers provides more features and more resource management tools than traditional COVID-19 trackers. Next. Revenue streams. Health insurance companies pay a $25 monthly fee and patients are charged a 25% extra fee per transaction. Doctor's subscription is a $5 monthly fee. Next. In rough calculations, if this system was implemented before the pandemic started, it would have generated in revenue streams over $40 million. Next. In conclusion, our solution can turn an infrastructural deficiency into a multi-million-dollar profitable, sustainable business that greatly impacts our island for best health outcomes during COVID-19 pandemic and as we move forward into the future. Next. Any questions?
Yes, the floor is open for questions from our judges.
Sure, I have a question. This is Chayla. I work with Holbert School. I was curious, you mentioned like some things like clinics, health guru. Are those programs that already exist that you're planning on interfacing with, or?
It's sort of like a branding scheme, I guess. Pandaid would be the general system, kind of like Microsoft, the company. They provide Office, and it has certain programs like PowerPoint and Word. Well, Pandaid, the general system, will have like subsystems or apps that are clinics, health guru, and symptom alert.
Okay, cool. Yeah, yes, it does. Thank you. I appreciate that. Yeah, thank you.
I have a
I
question.
have a question. Oh,
Go ahead.
thank you. Could you please confirm that patients or people using this would be charged $25 a month? Is that what you mentioned?
No. I mentioned 25%.
Oh,
okay. $25 monthly fee are for insurance companies, Medicaid, Triple S, etc.
Mhm.
And one of the perks of paying that monthly fee is that you can enroll your listed doctors on Health Guru free of charge. So your doctors wouldn't have to pay a $5 monthly fee. And then citizens, when they're paying their deductible, are charged a 25% additional fee if their health insurance is not subscribed, being Triple S, Medicaid. If they're not subscribed, then the patient is charged an extra 25%. But if
Are you
they're
concerned about access for people with low resources or limited resources? How can you cater this to that population?
Well, Medicaid, if I'm not mistaken, is the public health insurance that covers like 90% of the population. Yes, there is a small percentage that wouldn't be that wouldn't have a health insurance, but in a large scale, most people do. In special cases that they don't have health insurance or they have low resources, well, I guess that would come upon the doctor if they want to take that case as a pro bono.
If I may add to this part, keep in mind that these are rough numbers to get a general idea. However, the extra percentage that patients would have to pay is an additional to the regular fee that they would have to pay anyways for a consultation. So depending on what the doctor is charging them, then it'll be as much or as little as that. And these numbers can be tweaked to be more available for the general public to accommodate as many people as we can to help in this pandemic, while also maintaining a very sustainable model for our product.
Okay, we have time for one more question, I think, and Dr. Rodriguez Orengo wrote it in the chat.
Yeah, can you explain how this system will help the Department of Health COVID-19 tracking?
Okay, well, first of all, the idea is that since all the data is in one central system, it's easier and faster to access. And because you are servicing different type of customers, citizens, clinics, doctors, each of them have their own needs and they generate certain data. And by generating more data, you are allowed to make more summaries of that data. It provides them more information.
Okay.
It additionally makes sure that this is clean data, since it is in the same, since it's all under the same system, we will be able to clean up that data that it has been muddied by each different organization using their own method of giving this data to the government.
Okay, thank you, co-hackers. Great presentation. Now we will pass with simple coding. You can start whenever you're ready.
Simple coding, if you're talking, I think you might be muted.
Thank you. Before we start, we want to clarify that we are going to present in Spanish because of the freedom of speech, but we are going to answer your questions if you have in English. So that's a clarification. Buenos días, mi nombre es Yeriel Sayas Vázquez y mis compañeros son Abel Vélez, Yamairi Soto y Desiree Rodríguez. Hoy vamos a estar presentando nuestra idea de proyecto People Care by Simple Coding. Próximo. ¿Quiénes somos? Pues somos Simple Coding, somos estudiantes del OPR de Bayamón de Puerto Rico en sistema de computadora y tenemos como fin ayudar a nuestros envejecientes en nuestra isla. Próximo. El problema que tenemos, que enfrentamos es que siempre hemos tenido un problema con nuestros ancianos, que lamentablemente se nos olvida que ellos están, o se nos olvida ayudarlos porque no pueden hacer todo. Entonces con el COVID-19, pues esta demanda ha sido el doble, porque ahora ellos no pueden ni salir por ellos mismos, no pueden hacer sus cosas básicas como ir al supermercado, ir a la cita, comprar medicamentos, e incluso tener una comunicación con sus familiares, porque no pueden salir en ningún lado. Y el Centro de Periodismo Investigativo de Puerto Rico hizo una investigación y le entrevistó a algunos ancianos y decían que tenían miedo a morir de hambre porque literalmente no tenían nada de ayuda y no podían salir. Próximo. Entonces nosotros tenemos una solución. Esta solución es una aplicación dirigida a voluntarios y líderes comunitarios para ofrecer ayuda a las personas de mayor edad, solas o con condiciones especiales durante esta pandemia. Esto será como una conexión entre suplidores, voluntarios y ancianos. Sabemos que los ancianos no tienen la facilidad como nosotros de utilizar ay Dios mío, la tecnología, porque sabemos pues no nacieron con la tecnología como nosotros, así que tenemos estos voluntarios que pueden ser iglesias, pueden ser nuestros jóvenes de high school, que sabemos que tienen que hacer horas comunitarias para poder graduarse, y también pues todas las personas que tienen, obviamente tienen que ir por un proceso de entrevistas para saber que están capacitados porque queremos una plataforma segura y confiable, que toda esta información esté guardada bien. Próximo. Ahora vamos a hablar de nuestra sustentabilidad de nuestro proyecto. Este es un programa sin fines de lucro que los únicos ingresos que recibirá será para autosustentarse. ¿Con qué decimos esto? Solamente recibiremos dinero, el único dinero que estaremos recibiendo sería el que le cobraremos una cuota a los suplidores, ya sean supermercados, farmacias, pequeños negocios, incluso hasta unos laboratorios que quieran hacer las pruebas del COVID, que pues sería por eso nada más. Contamos con proveedores con servicio de la nube que permiten minimizar los costos operativos, que nos ofrecen buenos servicios de tan solo precios el primer año, un solo $1 mensual por tener esa base de datos segura. Próximo. Entonces, ahora vamos a estar explicando cómo funcionaría la app. La app lo vamos a hacer en algunos pasos para que sea más fácil. La app funcionaría: el voluntario entrevista al cliente y crea el perfil de la aplicación con toda su información. En esa aplicación se crea el perfil. Entonces, el cliente le informa las necesidades, si tiene alguna cita, si tiene que ir a algún lugar, si tiene que comprar algo, pues esto va y se va a guardar y se va a hacer como una orden. Entonces esa orden se le va a decir al suplidor o al pequeño comerciante o al laboratorio o lo que sea, y él lo va a tramitar. Todos ellos tienen que tener un sistema de delivery, un sistema donde puedan llegar a las personas para poder entregar el pedido al cliente y que se tramite el pago. El pago es algo que queremos aclarar, que nosotros no vamos a tener nuestra aplicación no va a tener nada que ver con el pago. El pago va a ser con todas esas suplidores que nosotros tengamos. Ellos tienen que tener el pago, como una ATM para poder hacer todo eso, y tiene que ver con todas las ayudas que a veces dan el Medicare y todo eso, que dan ayuda, el PAN y todas esas cosas. Entonces, en el paso 5, cuando ellos terminen, pues le va a llegar una notificación al voluntario diciendo que ya está ready, que ya todo terminó. Entonces, pues le va a pedir al cliente cómo fue la satisfacción del servicio, y estos resultados pues se le van a enviar a nuestro suplidor. Próximo. Ahora mismo no tenemos como una competencia directa debido a que somos una compañía sin fines de lucro y nosotros ningún dinero, nosotros nos lucramos de eso. La única competencia indirecta que tenemos son Uber Eats, Mac Home Services, que dan servicios a domicilio de medicina, de cuidado a las cosas, Supermax Online, y tenemos muchos más, pero no es algo directo. Próximo. Nuestra visión, queremos que de 3 a 5 años podamos empezar una plataforma más completa en términos de nuevos servicios de ayuda, que podamos conseguir auspiciadores para recibir ayuda gratuita para las personas necesitadas, crear un club que pueda envejecientes, solicitar, organizar giras y diferentes lugares en la isla. Próximo y sería. Nuestro
Estamos a
equipo,
tiempo, por
sería
favor,
todo.
concluya.
Sí, ya terminamos. Próximo y ya. Sería todo. Gracias por tu atención. Si tienen alguna duda o pregunta, pues estamos aquí para contestarles.
Muchas gracias. El floor está abierto para los jueces a hacer unas preguntas.
Quisiera una clarificación en cómo van a conseguir identificar a esos líderes comunitarios y llegar a esa población envejeciente o
Es una muy buena pregunta. Gracias por preguntar. Nosotros, cada alcalde siempre tiene se hace dentro de todo su plan de trabajo, siempre tienen esas personas que están con la comunidad. A pesar de que, vamos a poner, yo vivo en Toda Alta, hay una persona que se llama Auris Cintrón, ella está a cargo de esa comunidad. Entonces, ella te sabe quiénes son los líderes de comunidad y uno puede preguntar con ella. Además que uno puede ir también personalmente a los hogares y preguntar, porque vamos a poner, vamos a mi casa y yo le digo, mira, al frente de mi casa viven 2 señores que están de mayor edad y no pueden entrar. Pero lo más viable es ir a la alcaldía, que es lo más principal.
Una segunda pregunta sería cómo en el otro lado de la ecuación, los servidores, los suplidores de servicios, ¿cuál sería la cuota a pagar y cómo ustedes harían el contacto con ellos?
La cuota la hemos puesto que no es la misma para todos, porque sabemos que pues quizá puede haber un supermercado grande, pues puede pagar un poquito más. Pero pensamos un cierto porcentaje que sea súper mínimo, pero que ahora mismo como que no te podemos decir exactamente 1%, quizá un 2 o 1% para tener, pero es una cuota súper pequeña, que sea algo para poder pagar lo que nos falta de, qué sé yo, los programas que tenemos adicionales, pero es algo, una cuota pequeña y de acuerdo al suplidor que tengamos. Y ellos lo vamos a enterar porque pues, obviamente pues, pensamos hacer una campaña para buscar a otras personas. Nada más pensamos mucho hacer un anuncio de radio, que es algo que los ancianos saben mucho, y con eso se puede llegar a muchas personas. Incluso también se puede buscar a diferentes entrevistas, que es algo que es muy bueno para llegar a esas personas, esos suplidores, porque algo que sería en realidad no es tanta ganancia para nosotros, sino es más ganancia para ellos, porque solamente les damos ese espacio ahí.
I have a question. I wanted to know what would incentivize the volunteers, I guess, to do this as opposed to doing using another app or something like that? Because that is like a very important part of it, you know?
Desiree, ¿puedes contestar eso?
Hi. Well, to incentivize the volunteers, like your passion, the passion, for helping, the passion for, just seeing people smile, helping these communities, with their necessities, this like underrepresented communities, like, just the passion, to help people.
Also, I want to add that we will always have volunteers in Puerto Rico. To graduate, you gotta have some hours doing voluntary work. To graduate, you gotta have them. So we will always have graduating from high school.
We have, yeah, we have time for one last question. We have some comments from Dr. Rodriguez Orengo. I don't know if you guys want to address that in the last minute that we have.
Es similar a la pregunta anterior, ¿verdad? De que los voluntarios es parte esencial y que deben en su modelo mirar el pago de estas personas, porque eventualmente, sí, a menos vas a tener una rotación grande de personas y tú quieres personas que estén adiestrados o capacitados en el programa. Y lo otro es que deben considerar la parte de los planes médicos, ya que ellos por ley tienen que dar este tipo de o servicios similares a los que ustedes están ofreciendo y que puede ser un cliente para ustedes.
Nosotros estimamos dar un estipendio para ellos para poderlos incentivar a que puedan hacer eso, que puedan.
Oscar Misla por acá, pues si puedo hacer un último comentario. Las personas mayores tienden a crear una necesidad y una dependencia de estos servicios una vez establecidos. Por lo tanto, es importante que ese directorio de voluntarios esté siempre disponible o que ustedes puedan asegurar en la plataforma una plantilla de recursos que siempre van a estar disponibles, incluyendo 24/7, porque hay una serie de servicios que no esperan un horario laborable. Por lo tanto, el registro de esos voluntarios tiene que ser uno que se pueda monitorear el tiempo de respuesta.
Sí, nosotros tenemos una de las cosas que queremos para esta aplicación es que tenga un servicio de call center, que después que ya uno vaya una vez a donde la persona, ya puede, como creamos el perfil, tenemos toda su información, ellos pueden llamar en cualquier momento cuando tengan la necesidad y uno contestar y hacerlo por teléfono, porque es lo mismo que ir a presencial, obviamente porque ellos lo hacen ahí parte por parte. Y pues pienso que así sería la mejor manera de contestarte esa pregunta.
Súper, gracias Infocorin, tremenda presentación y buenísima idea, lo felicito.
Muchas gracias a ustedes por la oportunidad.
Gracias.
Ahora vamos a pasar con Covebusters. Cuando estén listos, you guys can start, pueden comenzar.
Hello, my name is Alisa Alejandro. I am part of the Cove Busters team, which is also composed of Cristal Delgado, Fabiola Perez, Sean Lim, and Gabriela Aviles. And I will be presenting our pitch for the Puerto Rico COVID Ideathon. Next slide. First, we must speak about the problem that concerns us, and it can be divided into these 3 points. Lack of information equals misinformation, which affects into no vaccination. From working deeply inside communities before, we have learned that a big part of the reason that many people are hesitant about vaccine adoption is that they do not have accessible and comprehensible information about the vaccine, or even about the virus. Also, many marginalized communities do not have internet access to protective materials, and are located in secluded parts of the island, making them prone to being forgotten. In fact, many do not even know when it is their turn to get vaccinated. Addressing these problems is key to stopping the spread of the virus and ensuring the health of our population. Next slide. We have also observed the quick decline of our population, which is indeed also a result of what I just mentioned and the pandemic as a whole. This is one of the many reasons this crisis must be approached with urgency and adeptly. We have come up with a holistic solution that tackles the problems we have mentioned. Next slide. And could you please play the video? This solution consists of creating regional COVID care centers partnered by a web app. We have divided Puerto Rico into 9 regions with 1 center each, as illustrated on the colored map you see on screen. The purpose of these is to regionally approach the public's health instead of island-wide. We proposed 3 optional locations for our centers: a recently closed school, a community center, or a tent. The center will be associated with a public health expert in the region or more, but we will begin with 1 and be staffed with health professionals as well as student volunteers. It will work on the region's overall health, data collection, and work hand in hand with community leaders in each municipality to provide protective material and vaccine and COVID-19 information to these communities. Each municipality associated to the center will be represented by a community leader, which will be able to speak up for his or her municipality's needs, whether it is PPE related or any other needs brought upon by the pandemic. But they will also be trained and provided with COVID-19 and vaccine relevant information so they can spread correct information to communities without internet access and supply them with protective equipment. For the population with internet access, we have designed the Mentioned and Here Portrayed web app. This web app will include information per region, where each region's tab will contain phone numbers, appointment and location information for near vaccination and testing centers. Since we also seek to combat misinformation, this web app also contains tabs to quick and simple videos, statistics, and articles on testing, protection, contagion, and vaccination in order for people to make their decisions surely and be safe. It also includes a survey designed to inform the person of their place in the vaccination phases and of their approximate turn, and many more features to come. Next slide. We acknowledge the broadness of our idea, which is why, directed by availability of resources and vulnerability, we believe Ponce is the best location to begin. This is also strengthened by the presence of Ponce Health Sciences University and makes our solution very viable and practical. Next slide. We have also estimated and budgeted the startup costs of this feat as a whole in order to conclude our contribution to this Ideathon and beating COVID-19. These include operational tools, healthcare equipment, technology, infrastructure maintenance, and volunteer stipends. Next slide. We are passionate about community and we are passionate about people. Help us bust COVID-19. Thank you for your attention. And if you want to help us begin establishing the first center, do not hesitate to contact us at this email. Do you have any questions? I think the video wasn't visible, right?
Yeah, I would love to see that video. I would love to see that video.
I think, can I send it to one of the planning committees?
We'll provide the video to judges in case they want to see it.
Okay.
Okay, thank you. Great presentation. The floor is open for some questions from the judges.
I have a question. How COV posters will interact with the Department of Health in Puerto Rico for the vaccinations, so resources that are needed at this network or these sites, regional sites that you are proposing to develop?
How will we collaborate with the Department of Health so people can be vaccinated at the centers? Is that the question? So we recognize that that is like bigger work. So we know that, right? We can't tell you this is how we will contact the Department of Health because we don't have a contact there right now. But that's why we designed the centers to collect data, to provide protective equipment. And when we establish them, we hope that they can become testing centers and vaccination centers. And as we perform alliances with other organizations, be able to communicate with the Department of Health so we can begin vaccination and testing in the centers.
Thank you.
You mentioned, I'm sorry, go ahead, go ahead.
Yes, this is Dr. Rodriguez again. Have you contacted any of the federally qualified health centers prior to your idea? Because they have a lot of resources and they are doing part of the work that you're providing. So I would suggest to focus on the application rather than try to buy equipment and make a center itself. So it's better to work as a collaborator in this field rather than start initiating all this infrastructure network that you want to do.
Yeah, that's a really good suggestion. That's why we are super open to creating like connections with these people. That's why we will begin in Ponce, because we believe that the university can help us doing these alliances and working on that, and so we can provide our community-centered approach to those centers who are doing that work. Thank you.
Maybe I missed this from your presentation, but how do you plan on getting the PPE and such like that? You said you were going to give some away, if I caught that correctly. How do you plan on giving that away? Or how do you plan on, I'm sorry, obtaining it? How do you plan on obtaining it without money, or do you plan on donations, or I'm just curious.
Yeah, that we were hoping that sponsors who saw this presentation could help us with that, because we recognize that it would be a lot of PPE to acquire by ourselves. So that is part of the reason we're doing this presentation, is so people can chip in and help us. Of course, we can also apply for grants and certain things like that.
Okay, we have time for one more question if anyone has one. Okay, if no one has one, great presentation. Thank you.
Thank you. I will make the video available to the planning committee so it can be shared with the sponsors and judges. It's a video of the web, like of what we've done so far of the web app.
Thank you.
Thank you.
Team Sofo is the next team up. You guys can start whenever you're ready.
Hi.
Okay,
So
you there.
let's start. Good afternoon, everyone. Thanks for this opportunity. Our team is named SOFO, which stands for Social Fork, based on the problem we'll be attending. Next slide, please. Puerto Rico has been facing complete and partial lockdowns since Q1 of 2020, while the COVID cases continue rising. CDC recommends if you're sick to stay at home, except to get medical care. According to HERSA, in Puerto Rico, the 50% of the COVID-19 results have a turnaround of 4 days or more. During this time, probable cases are going around looking for their needs. There's a lot of people without access to basic necessities. In the other hand, we have the nonprofit organizations trying to reach people who needs the service. Next slide, please. The solution is an online platform connecting patients, nonprofit organizations, and insurance companies where the patients can avail the services, which will be groceries, food, and OTC medications to support under the home quarantine. Next slide, please.
So our solution involves a way in which patients first, when they go into a COVID testing center and they get tested, they need to sign like a HIPAA privacy agreement to accepting to receive services. So, and once the test is done, they receive a COVID test ID. So this is a test ID that would be there on the COVID test kit. And once the test is done, the patient has to quarantine till the results are out. So during this time when the patient is quarantining, the patient can use our application and enter the COVID test ID and avail the services that are provided by the local NGOs. So once the patient puts this kind of service that he needs, the local NGOs are notified, and then they are going to provide the service to the patient. And in case the person is tested positive, the service can continue till quarantine lasts, based on the CDC recommendations. Next slide. Yes, so how it would work for the hospitals is that once the patient goes into the hospital or the COVID testing center, the samples are sent to the lab. And once the test is done, immediately the lab is required to enter the ID on our portal. And with that, also whether the person is insured or no. So that the right now, the insurance companies are reimbursing people for these services. And once the results are out, the lab also uploads the results of the patient. Next slide. Next slide. So for how it would work for the no, please. How it would work for the NGO networks is that NGOs would be notified of the number of people that they need to deliver the packages, and when they deliver the packages, the patient confirms that they receive the package, and these services are paid so that because insurance can pay back the NGO. And NGOs can use this data to work faster without conducting on-field research, and can also call for volunteers in case they need more. For the health department, we need to secure a bunch of permissions to install this ID system for the COVID test and secure funding for establishing and maintaining the platform. And the good thing about the platform is that it can also be used to generate epidemiology data that can be further used to track how effective the vaccine is, because we are testing whether the patient is positive or negative, and we know how many patients are positive in a certain region, and we could also know the number of patients based on the number of vaccines. We can sort of calculate how effective the vaccine is based on number of patients that are turning positive over time. Next slide. Next slide. Hello. Yeah. So the main two markets are non-profit organizations and insurance companies, and the future vision, it's fine. You can go to the next slide. Next slide. Yeah, and the future vision is to be a go-to platform for local communities in Puerto Rico to support one another in case of future epidemics. And another thing that we would like to do is expand our services for other ailments such as cancer and neurodegenerative diseases, and work with companies and nonprofits to further improve upon the platform. Next slide. We are a team of 3, and we have one health information administrator. We have a CEO of a nonprofit, and we have a researcher. Thank you for your time, and we are open to questions. Hello.
Yes, thank you. The floor is now open to questions from the judges. We have one.
I think that great presentation. I have a question. I see the arm of the NGO working faster than the Department of Health. But my question is that in the presentation appears that once the patient if the patient goes to the hospital, it depends that the hospital puts the information on the platform or report to you guys based on.
It's not a report. It's just so you just have the hospital only has to put in 2 things. One is the COVID test ID number initially, and then later with regards to the COVID test ID number, whether he or she is positive or negative. Those are the only 2 things that they need to do.
Good. So my question is actually, how you gonna work on the compliance from the hospital to do that? Are you gonna incentivize the hospital to go into to your platform and do that reporting when they have already?
Yes, because the thing is, right now patients are patients have no way to actually acquire, groceries and all the other things. The incentive for the hospital is that they would have less load of patients, because having this service would incentivize the hospital, because you won't have too many patients coming, because you'll have more people complying to the quarantine restrictions.
We also
because
are,
right
are
now,
thinking. I'm sorry.
Yeah, go ahead. Sorry.
Yes,
No.
we also are thinking in agreement with the hospital association, Puerto Rico Hospital Association, to see what we can do. What would they be interested on this agreement to make this work?
Yeah, I guess my question is, maybe this is like a not appropriate question, but why even limit it to the hospital IDs? I feel like by adding that, having to do that, you make it complicated when you have to see, oh, are these guys going to report this?
Yes, no, the ID will be the basically the trigger for our system. That will be the unique ID that specific sample. So in order to us to have that patient, it's our ID will be that one.
Okay, thank you.
This is Dr. Rodriguez. I just made a comment in the chat. Is that you have a good idea, but in order for this to work, you need to be in collaboration with the Department of Health in order to get the information from patients. Otherwise, it will be.
Yes.
And I think that they will have money for this.
Okay.
We have time for one more question if anyone has one.
To what extent, to what is Oscar, to what extent can you use these sources of information available to insurance companies? Huge percentage of the vaccinated people, of the tests that's being done, is being charged to the insurance company, and I know some of you can expand on that.
Yes, actually, the insurance company only have the information when the when the results are done or are billed to the company. So this initiative will give the insurances the information that they need on a timely manner. Once the patient is tested, what right now they don't have that information. Some of the insurance companies are offering paying for the delivery of groceries for the patient, but they don't know who really needs this service. With this application, they will have on their hands in a timely manner which really needs the service. So that's what we're gonna do with them.
Super, thanks.
Thank you.
Okay, if no one has any more questions, thank you for everything. Great presentation.
Thank you.
Thank you, judges. Now our next group is going to be Pitch Perfect. You can start whenever you're ready.
Good afternoon, everyone. Thank you for being here. We are Pitch Perfect. Next slide, please. We are 3 students composed of Mariette Correger, Jihan Liu, and myself, Christiane Lucedes. We all have different academic backgrounds, and we're super motivated to do this project. Next slide, please.
Thanks, Christina. So the problem. It's now over a year since the COVID-19 pandemic started. However, a lot of countries still struggle to control the transmission of the disease despite implementing numerous public health measures. For our research, we found that the problem is mainly due to the following reasons: poor risk assessment and misinformation among the population, and the lack of cooperation between stakeholders. Next slide. To address the issue, we're proposing a mobile app, which is called PR Health Check. It is an integrated public health app aims to provide comprehensive information of COVID-19 to its users as well as staff at points of entry. The app consists of 4 main functions: COVID surveillance and risk assessments, test results and vaccine passport, public health guidelines, and potential exposure alerts. Next slide.
As can be seen, this is our application concept where we want to be focused on the content feed, educational information and resources, risk assessment dashboard, and hotspots map. But we also want to make sure that the information is the most accurate and resourceful possible. Next slide, please.
So as you probably know, there's a lot, already plenty of apps used by countries and entities. So how are ours different? First, we provide a simple but accurate risk assessment tool, which is a color-based code that is generated from integrated information, such as your testing result, your proof of vaccination, and your public exposure risks. Second, the app can be personalized based on the needs of the institution, especially for its tracking function. Based on the institution's values for privacy versus effectiveness, the institution can choose to track with Bluetooth or GPS or both. Third, From our research, we found that most of the non-compliance are originated from the psychological level. Therefore, we designed our information tool based on psychological findings in order to encourage public health best practice and vaccine adoption. Next slide, please.
Empirically driven content. We want our app to be an interactive learning tool that is backed up by psychological research. It will be focused on social distancing, mask wearing, and vaccine adoption. Next slide. We want to focus on students mainly. Approximately, the UPR has about 58,000 students, and we want to emphasize on the increasing trends, the concept, the correct misperceptions of exponential coronavirus growth, and target user-specific content in the feed. Right now, there's a lot of misinformation out there, and people don't really know what to follow exactly. And as people know more about safety and the effectiveness of the vaccine, the percentage of people willing to take it will grow, and it will be better for society. Next slide. As said before, we want to target educational institutions. And why do we want to target them? Because the education supports prevention and recovery of public health. They also encourage the app as part of the health protocols necessary for attendance. The students are a big part of our community, and we want to be able to be safe, and mental health and public health is a big part of our lives. On the next slide, our resources, and thank you very much. Any questions?
Thank you, Pitch Perfect. The floor is open for questions by the judges.
Sure. Hi, this is Chayla again. Yeah, I wanted to know, how would you calculate risk from a person? I don't know if you went over that, but how do you plan on calculating? What data do you want to take in? Are you going to ask for some questions? Like, how do you plan on doing that?
Right. Thanks. So as we mentioned before, we calculate our risk factors based on two aspects. So like the first one is your health record. So like your testing results and your proof of vaccination, if any, will be uploaded onto this app. And also this app has a tracking function, and it will automatically calculate your public exposure risk to see like if you have been in the same place like with like the any positive case. So by combining these two aspects, we can generate like a color-coded code. So for example, like green, yellow, and red, and that is to determine your risk of infection.
Hi, I have a question about, to follow up this one, where your information is coming from. How are you gonna get all the data that you need to run your app in the different component of your app?
Right, thanks. So for testing results and your proof of vaccination, the best scenario is to get it from the health department. But maybe that's like, I mean, that's a pretty ideal scenario. But we also have the option to, for the user to upload them by themselves. And also like the public exposure risk is that comes from the tracking function of the app. So like the app will determine if you were in close contact with positive cases. Yep.
We still have 2 minutes for questions.
This is a comment for the team regarding the previous question is that the Department of Health, that they have public APIs. So you might be able to get some of the information that is public to any of their companies and groups that have worked here. So if you need any help, just let me know.
Oh, thank you very much. It will be really helpful if we have like one centralized data source. Yes.
Yeah, I feel like I mean, tell me if I'm wrong. I'm not a doctor or anything. I just write some websites, make some websites every once in a while. But wouldn't you run into HIPAA problems with trying to figure out, oh, if this person that has this app is actually like the person that was vaccinated, this John per se? You can't even expose names with HIPAA stuff, right? So like, how would you like? I feel like you would have to have some kind of own like authentication, special permissions, and something like that. Because I feel like that has to be a HIPAA violation. But maybe I'm wrong. I don't know.
Right. So let me clarify. Like, was your question related to like the identification of like the records? So like to ensure
Exactly.
whether okay, yeah. To my understanding, this the testing results and the vaccination has like the name, also like all the like identification information with the record itself. So at the points of entries, I believe they will match all the like information on the records with your personal information, just to make sure like it's the same person who are using this records. Yep.
Okay, thank you very much. It's perfect. If you can also, Dr. Rodriguez Orengo wrote his email, so you can contact him for any information. And thank you, great presentation.
Thank you very much.
And I'll pass for the J2R vets. You can start whenever you're ready.
All right, fantastic. We are J2R Vets. Good afternoon, everyone. We appreciate you having us, and we commend everyone here for a united effort to go ahead and offer the people better solutions in the shared fight that we share with COVID-19. This brief will be predominantly educational. We'll briefly go ahead and explain and offer community leaders a new approach to supply the organizations, the localities with the most sensitive FDA-approved test immediately by bypassing long and strenuous bureaucratic processes. In short, testing is dangerously limited in Puerto Rico, and we seek to create a grassroots effort to go ahead and provide people with our best, work hand in hand with community leaders, and spread a powerful message in the process. Next slide, please. J2R Vets, it's a service-disabled veteran-owned business. Our Puerto Rican founder, Mr. Raymond Gonzalez, is the former United States Air Force flight medic, an executive board member in the Northern Virginia Hispanic Chambers of Commerce, and a student at George Mason University. I am Matthew Passmore. I'm a graduate of the United States Academy and a former chemical, biological, radiological, and nuclear officer with the United States Army. Next slide, please. There's a third wave of COVID-19 happening across the U.S., and Puerto Rico is not an exception. As you can see on my left, there are areas in orange, some of the most populous locations that are at the brink of outbreak. And those areas in red that you see to your right are currently experiencing outbreaks as we speak. Next slide, please. As you can see, the daily cases are in an incredibly large amount. The infection rate being around 1 goes ahead and tells us that COVID continues to spread at a slow and controlled rate within Puerto Rico. And as you can see on the right-hand side, underlined, is an extremely high 21.74 positivity test rate, which tells us there's dangerously little testing, and that most cases are likely going undetected. So at these levels, it truly is quite hard to go ahead and determine how fast COVID really is spreading in Puerto Rico. Next slide, please. So the next two slides that I'm going to go ahead and go over should solidify some of those key points that I put out there. Out of all states in the United States for tests per 100,000, as you can see, Puerto Rico is well at the bottom. The state that's second to last has 3 times the amount of testing compared to Puerto Rico. Next slide. Out of the past 2 weeks of testing that happened in Puerto Rico, What you can also see concerningly is that all of those tests came out as positive. That's 100% of tests, which goes ahead and again shows you that this is an incredibly huge problem, the limitation on testing. Next slide, please. Also, there is some current vaccine misconceptions. The vaccine is a wonderful thing that was able to go ahead and get streamlined into our society. However, there's a misconception that things will immediately change, and it does not. The status quo does not change with vaccine implementation. At this time, there's not enough known about the vaccine to go ahead and accurately determine its effectiveness, as well as its effectiveness with SARS-CoV-2 mutated strains. Vaccinated individuals can still transmit COVID-19 and may experience no symptoms. We call those super spreaders right now, but that creates some concern. Recent studies also show that 59% of COVID transmissions come from asymptomatic individuals. Next slide, please. Additionally, when speaking about mutation with the SARS-CoV-2, current molecular tests by the FDA has been identified at providing false negatives with the new strains. To point out, there's three most commonly mutations unique to SARS-CoV-2, and that's ORF1, ORF8, and the N gene. Tests that rely on the detection of multiple regions of the genome may be less impacted by genetic variations of the SARS-CoV-2 genome than tests that rely on only one particular region, and that's coming straight from the FDA. Next slide, please. So our solution, what we'd like to go ahead and do is provide the people with what they deserve, and that's our best. As we know that detection is the first line of defense, and we want to go ahead and provide an adequate supply of top-tier FDA-approved molecular test kits to the Puerto Rican community. So early detection, as we see it, leads to earlier containment. Earlier containment, that leads to earlier self-care, earlier professional care. It limits spread. It clears up spaces in hospital. It goes ahead and reverses curves, opens the economy, and most importantly, it's saving lives. And we're looking at going ahead and doing this, covering all the upfront costs covered by our veteran team. And there's no out-of-pocket costs as well to the patient as well. Next slide, please. As you can see, our PerkinElmer test kit, it's at the very top with having a limited detection of 180 nanomolecules per milliliter. The top three competitors right now that you can see is Quest Diagnostics, Abbott Molecular, and LabCorp. Not only are they at least 1,000 times less sensitive, but they detect only one part of the genome, with being the N gene, whereas ours tests for two, or F1 and N gene. Next slide, please. Our vision is to go ahead and start in one locality and to go ahead and spread from there. Again, we are assuming all the upfront costs.
We are at time. Please conclude.
Okay, thank you. If you can go to my next slide, that should be my conclusion. Next slide, please. All right, so in conclusion, we're not going ahead and asking for funds. We're just looking to go ahead and help in spreading our message, looking at working hand in hand with community leaders to go ahead and reverse the curve, save lives, and give the people what they deserve, and that's our best. Pending your questions.
Perfect. Thank you very much. The floor is open for questions.
Hi, thank you very much for your presentation. I have a question in terms of the logistic and particularly the infrastructure that you need to conduct this testing. You said you're gonna base first on one locale. Can you give more information about that aspect of the site and the logistics that you need to start?
Yes, absolutely. And I appreciate that question. As you can see, there's a lot of information to go ahead and crunch down and provide in just 5 minutes. This is a new innovative product, and it's also a new innovative approach to things. So it's really hard to capture all of that just in one setting. So in saying that, we've noticed that there's kind of a slow process in trying to work through some of the local governments. There's a series of approvals that you have to go through, even some of the procurement process, and trying to go ahead and tap into some of the CARES Act funds, which some of the communities are provided by the federal government. That's a long and strenuous process. So we look at just going ahead and bypassing all of that and utilizing some of the leaders within the local community where they know that there's the most at-risk populations. There is a level of education that needs to be provided, because in some locations, those that are uninsured, I don't believe that they know that they can actually get a COVID test for free, where it's essentially covered by HRSA funds provided in the CARES Act. Those are the communities and localities we seek to go ahead and go after. We assume, again, those upfront costs. It's based on the organization, but if it's manning test kits and site equipment that's needed, we can go ahead and provide that. We do prefer to go ahead and work hand in hand with communities, such as church leaders, for instance. So who knows the communities better than the people that are embedded within the communities? We're not looking at going ahead and solving this all on our own. But as previously mentioned in the beginning, by going ahead and working hand in hand with the community, I believe that a powerful message of unity can be spread in the process as well in going ahead and reversing the curve and saving lives.
Just a follow-up to your answer. You guys are CLIA certified labs?
Yes, and thank you, because I need to go back and answer that first part of your question. But speaking of logistics, currently right now, what I know when looking up some data within Puerto Rico, that the molecular test kits that are there, they have about a 5 to 7 day turnaround rate. Our main lab is headquarters out in Fort Lauderdale, Florida. Right now, we are partnered with a lot of the airlines that go ahead and fly over to different islands, to include Puerto Rico as well. There would be quick logistics provided in the process. Again, it's hard to crunch down in 5 minutes, but we're looking at being able to provide a maximum turnaround rate of 48 hours, and having those results being immediately provided through our digital platform to the patient or to the organization to go ahead and give out to the patient.
I don't want to continue monopolizing the discussion, but I have one more last question. How are you going to report those results, and whether you are planning to share that information with the local government or public health situation?
Absolutely. So I can go ahead and give you an example. So let's say we go ahead and we find a church community that wants to go ahead and safeguard their congregation. We would go ahead and work hand in hand with them and have a memorandum of understanding between them. The moment we go ahead and we have that agreement and some of the logistics and details ironed out with that, we would then have our medical team to go ahead and submit the appropriate paperwork with the local health departments, so that when we go ahead and we get data for either negative or positive test results, we can go ahead and have our systems communicate with one another. And again, once we have those results within 48 hours, both the organization themselves or the individual patient and the government as well would go ahead and be supplied with that data. So there's that smooth, positive flow of communication.
One thing to note is that this does not have to be made. This is real world happening right now in other municipalities and states, and we would be bringing this and introducing it to Puerto Rico.
Yeah, this is Dr. Rodriguez Orengo. I just want to make you careful of the data that you are providing, because that's not the one that we're getting. Not all the testing in Puerto Rico are positive, and the positivity rate that you're providing of 21% is inaccurate. There's 3 different types of positivity rates, but the one that is all the samples is around 11 and 12%, not 21, as you mentioned. And we have done in Puerto Rico almost 1.6 million testing right now with molecular and antigen. So it's not as the graph that you presented. So you need to be careful when you come to Puerto Rico and provide the information, because it's...
So Mr. Rodriguez, I understand that piece. So the information that we provided either came from Harvard Global Health Institute, Johns Hopkins University, some straight from the government as well. I do know that sometimes that when it comes to testing, when it comes to the rapid antigen test, those are the ones that can go ahead and provide the results within those 15, 20-minute turnarounds. However, they are less accurate. And a lot of times those tests have to be duplicated and followed up with a more sensitive molecular test as well. So I know that sometimes I can kind of construe the numbers. That data that was provided was not saying that all tests ever used was 100%, just the ones within the past 14 days. Perhaps that information may be...
I'm telling you that is inaccurate. I mean, it's not true. Actually, in the past 2 weeks, that we have had less positive testing than in the previous weeks. So.
Okay. Thank you guys for the discussion. Moving forward.
I go ahead and reach out to the Johns Hopkins leadership to go ahead and see where those data came from for those past 14 days, so we can go ahead and make sure that both on our ends we're going ahead and supplying good information. At the end of the day, though,
thank you. We're at time and have to move on with the next.
Can I ask one question? Is that okay?
I'm sorry, we're past time for this one.
All right.
You can reach out individually afterwards. Thank you.
Thank you, guys.
All right, thank you.
Yeah, this was our last presentation from the track of health, and I want to thank all the teams, and it was a great job. And I will meet with the judges now to discuss the team. Thank you.
Thank you.
Thank you so much for these presentations, and thank you for organizing the track, Carlos. We'll be moving forward with the next track, economy. These are our esteemed judges for the economy track. We have Sofia Stolberg, representing Piloto 151, Mike Soto-Class, representing the Center for New Economy, and finally Nestor Figueroa, representing NAGNOI. We've been lucky to have Adrian Pagan, who is also a member of the planning committee, to be the track lead throughout the weekend. And Adrian Pagan will introduce the pitches.
Absolutely. Thank you, William, for the quick intro. I just also want to take a quick second and congratulate everybody on the health track for their amazing job over the last 48 hours or so. I think you guys all did a phenomenal job. You guys had great teamwork, chemistry. So really, from my part, congratulate you all for that. And now I am more than honored to present the economy track, which, from what I've seen, have also done a great job. These were my babies for the last weekend. So I'm just really proud to present my track and all their work they did. So without further ado, our first team that's going to be doing their pitch is called Team Tortuga, and their project is Por Más. So guys, take it from here.
Gracias, Adrián. Buenas tardes. Queremos empezar dando las gracias a todos ustedes por darnos una plataforma para presentar nuestra idea. Aquí está Por Más, porque como isla y puertorriqueños vamos por más. Próximo slide, por favor. Aquí tenemos una agenda de lo que vamos a discutir hoy. Próximo slide. Comenzando con el problema.
Ahora, pues, de acuerdo a estadísticas.pr, durante el COVID se estima que el índice de actividad económica tuvo una disminución de 6 a 8%. Y pues de acuerdo a un artículo de la Metro, no fue hasta octubre que el gobierno le ofreció ayuda a la industria creativa a través del incentivo para industrias creativas. Y pues durante COVID especialmente la industria creativa en Puerto Rico ha sufrido por una falta de exposición a clientela en Puerto Rico y también afuera. Y debido a una demanda creciente para productos locales, nosotros entendemos que nuestra idea es ofrecer a la industria un lugar centralizado para descubrir y apoyar artistas locales. Próximo slide. Pues para nuestro primer año queremos enfocarnos en cultivar una base de seguidores a través de redes sociales y un website. Eventualmente, después del primer año, nosotras queremos crear un mercado virtual con un sistema de envío y pago para que artistas puedan expandir su negocio. Próximo slide. Pues en términos de lo que podemos hacer ahora, queremos empezar con una cuenta en Instagram para ir ganando seguidores. También queremos crear un newsletter semanal donde vamos a ofrecer ofertas exclusivas para nuestros seguidores. Postearemos sobre eventos en la comunidad y tendremos un segmento de artistas del mes. Y finalmente queremos hacer un blog para que nuestros seguidores tengan un archivo de entrevistas y listas de artistas locales. Próximo slide. Y en este y el próximo slide les mostramos fotos de cómo se está viendo el website que estamos actualmente creando. Próximo.
Próximo slide. Aquí hay un ejemplo de las segmentaciones de nuestros clientes. Ellos son puertorriqueños viviendo en la isla o de la diáspora que tienen entre 18 a 50 años. Son personas que surfean las redes sociales para descubrir nuevos productos y tiendas locales. Y también tienen una inclinación a lo creativo y quieren expandir su conocimiento del arte y cultura boricua. Próximo slide. Aquí tenemos a nuestros 4 clientes ejemplares. María de San Juan, artista que quiere expandir su clientela y presencia digital. Pedro de Mayagüez, estudiante de artes plásticas que se gradúa pronto y no sabe cómo establecer una base de clientes ni cómo exponerse afuera. Tenemos a Benito de Naguabo, que le encanta apoyar lo local y todo aquello hecho en Puerto Rico. Y por último, Gabriela de Ponce, que es una aficionada del arte que no sabe cómo empezar su colección, pero al igualmente puede ser una consumidora buscando nuevo talento local. Próximo slide. Este es nuestro plan de trabajo para el 2021. Ya comenzamos a escribirle a artistas locales para entrevistarlos. En unos meses vamos a hacer cross promotions y lanzar la primera entrevista para demostrarle a nuestro potencial a los partners. Luego empezaremos a enviar nuestro newsletter seguido por el crecimiento de volumen de entrevistas y blog posts. Al final del año queremos hacer el primer exclusive drop con un artista junto al launch de nuestro mercado virtual, ya que estaremos construyendo la infraestructura de web y envío a través del año. Próximo slide.
Saludos. Entonces, como dijo Lara, parte de nuestra estrategia entrante es hacer estas conexiones esenciales con artistas. Aquí ya hemos escogido a 2 artistas con los cuales ya hemos empezado a hacer esas conexiones. Próximo slide. En adición, aquí hay 9 cuentas en las cuales queremos hacer partnerships para comenzar a hacer cross promotion que nos beneficiarían a ambos. Próximo slide. En términos de clientes, entre los 12 artistas y las 9 cuentas de partnerships hay alrededor de 1.2 millones de seguidores. Al penetrar tan solo el 30% de eso, tendríamos un 360,000. En términos de nuestro newsletter, si cogemos 60% de eso, que ya nos están siguiendo y ya están interesados en nosotros, llegaríamos alrededor de 200,000 y con ello, con el 20% de ellos, gastar $20 en una de las ofertas de drops exclusivos, llegaríamos a 860,000. En términos de al llegar al mercado virtual, con que el 10% de ellos gaste $50 al mes, llegaríamos a 22 millones y con alrededor de 10% de ganancias tendríamos 2 millones. Próximo slide. En términos de la competencia, tenemos a Society6 y a Etsy, que son ventas y infraestructura globales. UVA, que son productos locales, pero son tiendas establecidas, no artistas individuales. En términos de fomentación de descubrimiento, tenemos a la Expo, pero solamente lleva a cabo ese servicio y nosotros venimos a llenar todos los boquetes. Próximo slide. Con eso, mi nombre es Sofía, Lara y Claudia. Muchas gracias y nos dejan saber si tienen alguna pregunta.
Thank you so much, Team Tortuga, for that great presentation. And now we will open the floor for any questions that you just might have.
Sí, yo tengo una pregunta. ¿Pueden volver al slide de los financials? Y me pueden explicar un poco más qué es lo que están asumiendo. O sea, que los productos, los artistas que ustedes que van a invitar a la plataforma, son artistas ¿cuál es el average price point de las piezas que pueden tener? O sea, de ahí es que sacaron los $20. ¿Y cuál es el business model? Explíquenme bien mejor eso. El incentivo para el artista a entrar en la página, el average price point y el business model de ustedes.
Sí, pues en términos de average price point queremos tener una variedad de precios. Obviamente todavía al estar comenzando a hacer las conexiones con artistas no tenemos un average en general. En términos de los $20, la razón por la cual lo ponemos aquí es porque esto sería para los exclusive drops, que sería en conjunto con los artistas, así que sería algo exclusivo que tendrían solamente nuestros seguidores, dado como decidamos si sea al newsletter o al blog. Así que por eso...
¿Qué tipo de artículos? O sea, artículos obviamente mucho más económicos que una pieza de un artista. O sea, quiero entender bien cuál es ese artista que va a entrar a la plataforma y si en efecto van a tener una variedad bien grande, pues cómo poder salvaguardar el que algunos van a cobrar más por sus productos y otros menos. Y luego entender esos $20 y cómo llegaron a ese revenue.
Sí, pues como dije, sería en conjunto, así que nosotros no nos llevaríamos el completo número de dólares de la venta. En este caso, estábamos usando ejemplos como Maya Pagan o como Mike Urban, que en términos o sea, no es un precio de, qué sé yo, de $100, que si llegaríamos a hacer algo en conjunto sería a este price point. Ese fue el ejemplo del cual nos dejamos llevar de esos 2 artistas que nombramos anteriormente, que ya hemos empezado a formar esas conexiones. Y entonces luego en el mercado virtual, como ves, ya se va cambiando al porcentaje de ganancia.
10%, ok. 10% del total de la venta, de la transacción.
Gracias.
Yo tengo una pregunta, me encantó la presentación y creo que, y en esto Sofía conoce mucho de la economía creativa, la gente no le da suficiente importancia, pero en la opinión de ustedes, ¿qué es lo más difícil de provocar a alguien que compre una pieza de arte? Usualmente la gente piensa que esto es personas con mucho ingreso, obviamente yo creo que ustedes están yendo a un mercado diferente, pero ¿cuál es como el obstáculo más grande que ustedes han visto de que la gente gaste parte de su disposable income en arte?
Pues de lo que hoy actually tuve la dicha de tener una conversación con una de las artistas que hemos comenzado a formar esa conexión, y de lo que ella me estaba hablando, en realidad que el problema más grande de la perspectiva del artista, especialmente durante COVID y de artesanos en Puerto Rico, ha sido que es básicamente whether or not tienen presencia virtual. Porque ya que no pueden, o sea, no hay un festival en las calles de San Sebastián donde por X o Y razón alguien llega a tu mesa y tú le puedes explicar tu misión bajo tu trabajo, ¿verdad? Y eso era lo que ella me estaba explicando, que a alguien no tener el recurso de poder entrar a un mercado virtual donde personas de la diáspora, de otros lugares de Puerto Rico que no necesariamente estén en el mismo pueblo, puedan hacer ese descubrimiento. Y eso también es parte de nuestro modelo, que queremos realmente hacer innovación en la manera de cómo se introduce un artista virtualmente, que queremos hacer con las entrevistas y con otras formas de introducir al artista y sus piezas de una manera que realmente pueda decir lo que ellos quieran decir por el arte.
Muchas gracias, Sofía, y al grupo Tortuga por su gran presentación. Ya estamos más o menos al tiempo. Podemos pasar, por favor, al próximo grupo, que es Coconet. Coconet, cuando ustedes estén listos, por favor, please take it from here.
Hello and welcome to the CocoNet pitch. Next. The life science industry is extremely important to our island's economy. In fact, it makes up around 30% of our annual GDP. Due to the phase out of incentives in Section 936 of the US tax code, many companies in this industry left Puerto Rico, leaving behind a disastrous economic impact. But now with the ongoing coronavirus pandemic, it is clear that the US is heavily reliant on foreign medical manufacturing, which is leading congressional leaders to introduce legislation to reshore production. This presents a unique opportunity for Puerto Rico to become the manufacturing hub that it once was. Next. However, companies that want to relocate to Puerto Rico, or even the ones that are already here, need engineering firms or service providers that are qualified to work on their project. Take the example of Lorena, one of our mentors for the Ideathon, who works in this industry. As a project manager, she contracts these service providers for the multiple projects she works on in a given year. However, she always comes across the problem that there is no central database to find these providers, so she has to scour the internet for them, post openings on job sites such as Indeed, call friends, and much more. However, her problems don't end there. After she spends all that time finding a service provider, she also needs to qualify them to make sure they can work with the company, which takes even more time. Next. Let's take a closer look at the process Lorena goes through to qualify a service provider. First, she needs to make sure the provider is registered to do business in Puerto Rico and that they have basic requirements such as state and liability insurance and that they have the financial capabilities to take on the project. After that, she has to make sure the provider meets the good manufacturing practices put forth by the FDA. And finally, she has to verify the provider follows government health and safety protocols. This process takes her a little over 2 months, but there should be an easier way. Next.
Which brings us to our solution, a web platform where project managers such as Lorena can find qualified service providers for their projects. Let's take a look at the platform and see how a buyer would go about finding a service provider. Next. Coconet is an interactive, easy, and user-friendly platform where a user is able to browse and select the service they're looking for. Next, please. Users will be able to search providers based on different criteria that best fit their needs. And after identifying a provider they like, they can click on each specific provider for more details. Next. On the company page, they can see the service provider's general information, previous clients and projects, their reviews and feedback, and most importantly, their qualifications. Users will be able to connect, communicate, and interact with providers via the platform. We believe that with such platform, medical manufacturers will be able to cut down the qualification process from 2 months to perhaps 1 or 2 weeks, and potentially cut costs by upwards of 25%. Next.
We estimated the size of this opportunity by looking at the total value of construction in Puerto Rico in a given year, which is $7.5 billion. Then for a serviceable available market, we took the value of private construction alone, $3.5 billion, and arrived at our obtainable or beachhead market by taking the fraction of the SAM that is attributable to medical manufacturers, 105 million. Next. This platform will operate under a SaaS model where medical manufacturers will pay an annual or monthly fee to have access to providers' information. Providers will also pay an annual or monthly fee to receive the verification and qualification icons. Next. We are confident these firms will pay for our solution since there is no platform tailored toward the life science industry. Other websites such as Construct Connect, Angie's List, Thumbtack, or even Yelp are only helpful for general and residential construction and services. Thus, manufacturers are limited to consulting qualification firms, but that involves yet another layer of searching. Coconet because compile the industry's information into one place and provide the most value. Next. Eventually, we think we could also replicate this model for other sizable projects such as residential and public construction, like the websites mentioned before, and even expand into other emerging or developed markets in Latin America and the US. Next. Our team is made up of 3 Brown University students. Manny, who has experience working in the tech industry, will tackle the development of the platform. Abby, who has research experience as well as biotechnology and pharmaceutical knowledge, would lead the customer discovery process. And myself, Jaime, experience in finance and business development, will structure the business. I believe our diverse skill sets and experiences make us the perfect team to build this platform. Next. We truly believe we can add tremendous value to the medical manufacturing industry and help rebuild Puerto Rico's economy. Thank you for your time. We're now happy to answer any questions you may have.
Team Coconut, thank you so much for that great presentation as well. We will now open the floor for any questions the judges might have.
Yeah. Do you guys think it's a very interesting idea, and certainly the issue of finding employees is vital in Puerto Rico. I hear that often. Is the kind of service that you'll provide, do you think it'll be useful to companies across the board? From what little I know of this, it seems like each, especially in the medical manufacturing and medical devices, it seems that each company has maybe some general areas where they coincide, but a lot of very specific needs to them specifically that is probably the reason why they kind of look for people on their own. So is a platform a good idea in that sense? You mentioned Angie's List, for example. So usually people that need a plumber, they all need a plumber for the same reasons. But I think medical device people probably need a person that does a specific thing that everybody wants, but then some very specific things that they only need. So how will you be able to deal with that situation?
Yeah, that's a valid question, and we've certainly given it thought. I would appreciate if the person controlling the slides could go back to the search by service. So yeah, in order to tackle that problem that's specific to the companies in the medical manufacturing industry, we're going to try, and we'll do this through surveys as well, to bucket the types of services that they mostly need into these different categories. And inside of them, they will even have particular services within that category. So when we identify the service providers that are able to give the services, we would put tags on them so that when the person is searching them on the next slide, they would be able to use the filters to specifically say what are they looking for, which service, and find that provider based on that and on those needs. Does that answer your question?
Yeah, thanks.
Perfect.
I have a question too. Regarding your business model, so I can see the value of something like this initially. when a company is moving down to Puerto Rico and trying to find those service providers, but how do you continue to get that recurring revenue once they've already made these service providers preferred vendors and gone through their entire procurement process, in which case they'll probably continue to do business with them. So how do you ensure that you continue to bill for having them on the platform, or will they even need the platform once they're already here and have contracted initially?
Yeah, that's definitely a totally valid point. I would appreciate if the person controlling the slides could go to the right. Yeah. Past the appendix. Yeah. To the go-to-market strategy. Yeah, perfect. So yes, as we mentioned, we are a SaaS model, so we're definitely shooting for that recurring revenue stream. And although you touched on the point that they would be more useful for companies that originally established on the island, I would actually say that it would be even more useful for the companies that are already operating here, because these companies have projects all throughout the year coming, and there are many companies, like 40 plants around the island, and the amounts of projects, there are a lot. So they're continuously looking for service providers throughout the year. And if they're able to include in their bidding process more service providers rather than the one or two that they already know, and discover them by going to the platform, that would be a tremendous value add for them, because they would be able to save costs related to the project, and that would incentivize them to stay on the platform and pay that annual fee to get the recurring revenues. Does that answer your question?
Yeah.
Perfect, thanks.
All right, let me just make a quick comment, and maybe you cover that, Jaime. But I think it's very important to for the companies to receive like a rating or something to assess the quality of the services that these providers are giving, and that will be a good way of who can stay in the platform and who can't. Right, the ones that are not doing well, that they don't get a good feedback from customer. It will be someone that probably will not stay in the platform in the future. That way you continue making sure that the ones you have there are the best of the best, because that will be important for the ones receiving the service, that the vetting, it's constantly, it's continuously. And at the same time, it's good feedback for the service provider to get better and better, right? They might miss something, but they could receive that feedback and do better the next time, right? So just a comment. It will be a great opportunity also to do that.
Yeah, absolutely. We've definitely given it thought, and if you notice there in the keep of the go-to-market strategy, a regular client check-in and feedback would touch on that point, and definitely provide that value that you're saying. And if you go back to the examine provider slide on the left. Yeah, previous one. Yeah, one of the most critical parts of it is their previous clients and the selected projects that the company chooses, and the reviews, the ratings that they give. We've had interviews with people, senior buyers in the industry, and one of the things they would say they would like to hear about is how much time the project took, if they completed it like on time, the cost, and that sort of thing. We would definitely include in the platform to filter out who's a good provider and who's a bad one.
So this could be an awesome competitive advantage, right? And a differentiator for your platform, your vetting process, right? So that's very important. Thank you.
Yeah.
Thank you, Team Coconut, and thanks for the judges for the questions and insights. Now we'll be moving towards our next group, which is called Team Kiosco. So once we have their deck set up. All right. So Team Kiosco, whenever you guys are ready, feel free to take it from here.
Thank you. Good afternoon, everyone. And my name is Antonio Santos, and I'm here to present Kiosco. Don't just work from anywhere, work from a Kiosco. It's March 15th, 2020. It changed the way we live life in Puerto Rico. It changed the way we socialize, how we engage, but most importantly, how we work. Next slide. So COVID had an impact in the way that we engage and work throughout the island. As COVID ramped up, headquarters became home quarters. We saw an increase by 50% of a remote workforce, people working from home. Therefore, virtual became our reality. That being said, as headquarters began to downsize their office space and de-densifying their square footage, that created an influx of underutilized spaces and idle spaces. Adding to that, workspace inventory increased dramatically. And there was a hospitality shock. Most sectors that didn't survive the stress test or are actually undergoing the stress test were hotels, restaurants, co-working spaces, not to mention, because they really wrap into hospitality and the service sector. So that being said, how does Kiosco reconcile all these dynamics of hospitality, tourism, remote workers, and office space? Next slide. Next slide, please. So we decided to work and foment, we decided to foment and build a platform, a marketplace, which we call Kiosco Marketplace, which reconciles hospitality, tourism, the demand for office spaces for the new remote workforce that is ever increasing and visiting our island. We believe that the remote workforce, which has increased by dramatic events more than 50% afterwards, are visiting the island and they are looking for places to work from. And given that not only are they looking for a place to work from, they're also looking for unique spaces. And we believe that Kiosco Marketplace will reconcile and bridge those demands from both sides. Off to you, Kevin.
Sure, so next slide. So in terms of sizing the opportunity in Puerto Rico for Kiosco, it's a little difficult because even in terms of co-working spaces, there's no data on what the revenue side is and how large it is from a revenue standpoint. But what I did is, with the information that was available on the US market, I'm able to get an idea of what Kiosco would look like in the entire US, and then we could kind of break that down. So the entire revenue for co-working spaces in the US last year was 26 billion. And then if we look at the number of workers who are remote, who are actually choosing to use co-working spaces, that's 8% of the total of remote workers. And that number, of course, has increased 50% in the last year. And then 44% of those remote workers are actually traveling and working simultaneously at least 1 month out of the year. So at least 1 month they're in a different city than their home and they're working remotely. So if out of that 44% that are traveling and working, we can capture some of that 8% who prefer to work in co-working spaces and get a sense of community, because overall 19% of remote workers cite loneliness as one of their biggest challenges. So bringing that sense of community in a safe way, in a COVID safe way, but also offering the flexibility that somebody who's traveling as a digital nomad might need. And if we can go to the next slide, just talking about what's already, the infrastructure already set in the island. So we have huge players such as Piloto, we have Cocoa House, we have the Landmark, but we also have coffee shops, hotels, and Airbnbs that people are working out of right now. So instead of seeing these players as competitors, we see them as partners, as potential partners that we can offer flexibility, we can offer a seamless booking platform, and we're offering an entirely different market that seeks more of a flexible work style that they can work from anywhere in unique locations, not just necessarily an office. So I'll let Francisco talk more about the partnership opportunities. On the next slide, sorry. If Francisco's not on, then I can take this. Oh.
Yeah, I'm on. So our vision for Kiosco is to expand in the next few years through third-party partnerships, as well as geographic expansion. We see Kiosco as having a positive impact on not just the remote worker and local property owner in Puerto Rico, but also the community surrounding the co-working spaces. By, for example, partnering with taxi services for remote worker transportation, to collaborating with paradores and even catering services for work lunches, Kiosco will contribute to an ecosystem of added value for the communities in which it will serve. We also aim for geographic expansion once well established in the San Juan area. We aim to be island-wide, as well as the potential for expansion into other parts of the Caribbean, Latin America, and the US. Next slide. The Kiosco team has a combined 40 years experience in hospitality, real estate, and technology. We truly believe in and are committed to Puerto Rico's future success and are excited to bring you Kiosco to empower local Boricua property owners and the surrounding communities and make Puerto Rico the remote worker tourism destination of 2021. Thank you.
Thank you guys for that great presentation. Thank you, Kiosco. We'll now open the floor for the questions that the judges might have.
Hi, yes, so very interesting. I have a lot of questions, of course, because I am in the industry. I think for starters, I'd like to understand what is the unique value that you guys are bringing to the table? Is it a booking engine? How is that different from people just going into co-working spaces or renting Airbnb? And what are you doing about making sure that you are able to understand, whether or not the internet infrastructure is there for people to work? How exactly does the app work? I think that's basically the bottom line. I'm a little bit confused.
Well, I'll start off. First of all, thank you, Sophia. It's an honor. We know Piloto is, of course, a trendsetter in establishing the co-working experience in Puerto Rico. What we tend to want to do is it's to replicate the Piloto Cocoa House experience of community of a startup ecosystem. We as a platform could expand that and connect with spaces that are remote, spaces that are idle, and we could just convert those based on a certain criteria that we would have that checks off those boxes of reliable internet service, security, safety, even COVID protocols as we speak. So we will have to curate spaces, allocate them, very different from establishing a brick and mortar. From establishing a brick and mortar as we go, we could just have a branch of network and have them hosted on our platform.
Yeah, if I can expand on that as well.
Sure.
So basically our concept is if you had a restaurant that was only open from 4 p.m. to 10 p.m. and you're not using it during the day, you could convert that space into a co-working space during the day. And that's one element of our target market as far as the workspaces. So from there, you could get some really unique spaces and also reach parts of the island that co-working spaces, there's just not enough of a market for like a traditional expansion. We could get to cities like Arecibo and Ponce and Mayagüez in the west or Fajardo in the east by actually offering a flexible sort of hybrid model of like between co-working and a coffee shop where you can stay the whole day, unlike a coffee shop, but it's also offers you that flexibility that you can work from different spots of different sizes.
And just to further elaborate on that, I think the key differentiator here, as was said, is the flexibility of being able to choose different co-working spaces according to tiers. And each tier, as you progressively get to more expensive spaces, we would include more amenities such as like generators in order to protect your co-working space from power outages and increased security measures as well. So it just gives you the flexibility to be able to truly work remote in a continuous and uninterrupted manner.
I think
and what's your business model? Oh, go ahead, Mike.
No, I was just gonna say that the notion of underutilized spaces is super interesting, but how do you, I mean, curating, and I think, Sophia's point, how do you maintain places is very difficult. I mean, how do you ramp up quickly enough so that you're going to be in charge of, hundreds of properties eventually you want to do, or even if it's just 10, I can imagine people's reviews saying, hey, they sent me to this place, there's nobody here. Somebody else saying, hey, the internet is slow here. I think part of what organizations or companies like Piloto has been able to do is that you go to any one of their places and you have an excellent experience, and they have a huge team making sure that, everything works. So how do you go to a place, you mentioned towns out in La Isla. How do you make sure that those places are up to par I can see you doing that with one, but how do you do that to scale?
This is where we actually that's where the curating part comes off, because what we want to do is replicate the experience you would have from per se working at a piloto, and not feasible would be I'm sorry, Sophia, I just want to use piloto because you are laid the groundwork, but having Sophia build a piloto in every township, it would be easier to scale that experience of working in a co-working space throughout to the network, which goes to the business model of we have a host and we have a user side. So it's a marketplace where it would be a percentage of the host space rented out, and of course the user of the platform who's looking for the space. That would be the initial business model. We're not sold on that yet, but it would be one of the ways that we could actually generate revenue as we move along. And then I guess tier. But overall, our focus is having that criteria, that template of what's expected from a workspace, and how we just replicate that and scale. It's controlling the experience. It's similar. Don't want to never like to use other like Airbnb, but it's going to be a rough start of monitoring each experience. But we believe it's doable, and we believe it's something that we believe in, and something that most platforms like Airbnb doesn't have is somos de aquí, somos de la isla. We have our cultural DNA embedded.
Hey guys, we do have one, time for one very quick comment for the sake of time. So if any of you has a wrap-up comment, that'll be great. If not, we can move forward. Are we good? All right, thanks. So
thank you so much.
Yep. No, thank you guys for taking time participating in the event. Thanks for the judges for the really insightful questions. And now we'll move forward with our last theme of our track called De la Casa. You guys can take it from here whenever you guys are ready.
Yeah, my camera's trying to turn on. Okay, there we go. Can you see me?
Yep, we can see you, Gabriel.
Okay, okay, I'll start. Good afternoon. My name is Gabriel Rodriguez. My teammates are Claudia Monge and Cristian Ramos, and we will be presenting De La Casa, where we encourage you to choose local. Next. Puerto Rico has an average of 90,000 locally owned businesses. Since the arrival of this deadly virus, we have experienced a severe island-wide quarantine, followed by strict restrictions like curfew and a percent on people that can be inside of establishments. This varied from 25 to 75% according to executive orders. For businesses that had a capacity for small groups of people, these restrictions led them close to bankruptcy. Even before the pandemic, these locations were still struggling because many tourists or even the locals did not know they existed. Next. The way my team intends to tackle this is by constructing an application for the users that helps tourists and locals find local or small businesses throughout the island. This would include tourist attractions, food trucks, handicrafts, and others. These are all locations that heavily impact Puerto Rico's economy. This is because they either have a high influx of tourists or could receive them if only tourists knew where they were. Next. We will also be preparing a computer application specifically for business owners where they have full editorial power over their business, from contact information, catalogs, menus, and address and statistics page. Could you please go back? I forgot something. Okay. Let's say you were on vacation in a place you've never been to. You would like to experience the culture and excitement the locals witness every single day. Although you realize you have no idea where to start looking for these locations. One of the best ways to find these locations would be to ask the locals, but even they don't know every single place to explore. With the help of this application, you can filter by your preference. This app can help restart the local economy by pointing tourists in the right direction to experience true Puerto Rican culture. Because let's be honest, where would you go to experience this culture? A shopping mall or to a local business where they appreciate every single person that walks through their door? Next. According to the Weekly Journal, we have a market size of 90K local businesses and of 40K of those are small businesses. So we have a pretty wide market range to work with here. Next. Our business model focuses on being a nonprofit organization that aids the community, provides accessibility for all, and helps the locals. Next. Here we have a prototype that we built for an application, for the application we're suggesting. As you can see, it has a login page, it has map references, you can sort by categories, there's a main page, there are reviews, etc. Next. No salió el demo. Okay. We have a, oh wait, it's there. Okay, cool. We have a demo that shows the actual application working, and it's several features we just demonstrated in the past slide. Next. As you can see here, we have the business view versus the client view. The business view will vary depending on the type of company or business the employer is running. It could be a retail, a store, anything. We focused here on food. As you can see, the client view will see everything the business owner wants you to see. Next. Okay, why are we better? What makes our app distinct from similar apps in the market can be expressed in our motto, choose local. Our competition might have these local businesses in their system, but they might get overshadowed by bigger corporations or brands. Our goal is to boost the local economy by bringing these local and small businesses into the spotlight. We want the user to experience true Puerto Rican culture. Next. Our marketing efforts will be centered on tourist arrival locations, focal points where tourists can actually see where the app is located, and we will also require any business in the association to have a sticker to identify us. Next. The vision is we want an online shop, and we want to build a scouting team and better improve the features of the app. Next. This is the team, and we are De La Casa.
Thank you so much, Team De La Casa. Now we'll open the floor to our judges if they have any questions.
I have two short questions. One, you say why we are better, and I guess my question is better than what? That's the first question. And the second one is, why did you choose to go as a nonprofit? Why not generate a profit and just use a for-profit model?
Okay, that's a very good question. For the nonprofit one, we want to help the local economy, and we view it as kind of unfair to charge the people we are trying to aid in all of this, since the same local businesses and everyone we are trying to add to this app is struggling financially. It's a very tough point in time right now, and we feel it unfair to charge them right now. What was the other question?
How are you going to make money?
We plan to do it with sponsorships, and we plan to add a donation button. Like if the businesses want to donate to us and cooperate with the app, they see that it's working, we will gladly accept and use it to upgrade our app.
My question is related to Mike's, in that, I guess, related to other platforms, right? I'm thinking Yelp, TripAdvisor. How are you going to be able to provide the type of SEO that these local businesses are going to need so that people even find your platform to begin with, right?
As we said, our business model is try to focus on local businesses where apps like Yelp and TripAdvisor all focus on, like they're included, but big chain brands often overshadow them. So our plan is just to have the local businesses be the highlight, the full spotlight, so people actually go and visit them and actually go shopping there.
I believe Nestor had a question or a comment.
The question was about the economic model, but I think Mike asked a question. Just to comment, I guess it's just for your team to think, maybe beyond just like one transaction, then go to a place and get something to eat and come back. Think about the experience. maybe this is a great opportunity to link, you know, a place to eat with a tour around the area, or maybe where you can do like hopping of multiple places. Just you know, you could draw a path of multiple experiences and try to distinguish yourself, or create a more compelling differentiator. I sort of see where Sophia is going with this. You know, there's a lot of competitors, you know, a lot of those apps, more mature, are offering that. But I think if you switch it towards a more experience-based, it could sort of, you know, differentiate you from the competitor. So just food for thought.
Okay, we'll definitely keep that in mind.
I believe that's all for Group de la Casa and for the economy track as a whole. So once again, I want to congratulate all the teams that have presented so far, economy and health track. You guys have done such an amazing job in the last 48 hours. I do have one last request or favor to ask the judges. I'll kindly ask you guys to refer to the Slack channel where I'll be posting the deliberation room link so that we can all chat and record the scores. So thank you guys again. We'll hopefully see you at the closing ceremony later today.
Amazing. Those are very excellent slides and very excellent pitches from all the teams.
Good job. Good job.
Thank you to our judges from the economy track for your very important questions for the teams. Now we'll be moving forward with.
Good luck.
Thank you. We'll be moving forward with the next track for the Puerto Rico COVID Ideathon. Next track will be education. Next. For the education track, we have a number of distinguished judges. First, we have Roberto Jimenez Rivera, member at large for the school committee for Chelsea, Massachusetts Public Schools. We have Hector de Jesus, postdoctoral fellow at MIT and co-founder of the Sagrado MIT Neuroscience pre-college program. Also Latino Forbes 30 and the 30. Paola Figueroa Delgado, PhD candidate and researcher at Yale University. And Jennifer Sullivan, territory account manager at Dell EMC. Margaret Anderson has joined us as the track lead for the education track. She has worked very hard this weekend to help bring teams and lead teams throughout the 48 hours of the event, and she will be presenting the pitches for the education track.
Thank you so much, William, and a huge congratulations to all of the teams in the health and economy tracks for your really amazing presentations today. I have been so energized over the past 48 hours working with all of you and seeing the hard work and innovation that each of your teams have put forth. I've been especially proud of the 14 individuals working across 4 groups to create innovative solutions in the education track. I'm very honored to be here today and to present your teams. Without further ado, I present to you Siembra y Cosecha. Feel free to begin whenever you are ready.
Buenos saludos, espero que todos se encuentren muy bien. Durante esta tarde de hoy les estaremos presentando lo que sería la inclusión y capacitación para estudiantes y profesionales con necesidades especiales por el equipo de Siembra y Cosecha. Próximo, por favor. ¿Quiénes somos? Nosotros somos un equipo multidisciplinario con experiencia en la industria de programación, farmacéutica y administración de empresas. Próximo, por favor. Somos una solución sin fines de lucro que estaremos recibiendo fondos a través de donaciones de individuos y corporaciones, como por igual estaremos ofreciendo un espacio de anuncios para entidades relacionadas. Próximo, por favor. El problema que hemos identificado a través de nuestra investigación ha sido que los estudiantes y profesionales con necesidades especiales han sido dejados de lado en la sociedad de Puerto Rico. Nuestro enfoque son los estudiantes y profesionales con necesidades especiales, ya que las entidades pertinentes no han logrado proveer un método para asegurar la comunicación efectiva con ellos. Próximo, por favor. Estas son las gráficas con las estadísticas más recientes que datan entre el periodo del 2014 y 2020. Próximo, por favor. Nuestra solución para este problema está enfocada en nuestros estudiantes y profesionales con las necesidades especiales. Próximo, por favor.
Sí, muy buenas tardes. Mi nombre es Nelson Yamil Pérez. Básicamente la solución se divide en dos renglones, lo que es el renglón offline y lo que standalone, o sea, una aplicación instalable, y el otro renglón pues sería lo que es web-based. Básicamente la que es offline sería un contenido globalizado, ¿verdad? Donde los estudiantes estarían descargando todos estos módulos cuando ya tuvieran los videos y el closed caption ya procesado. Próximo slide, por favor. Ok, entonces la versión web-based sería una versión donde tenemos el contenido centralizado, donde sería un procesamiento real time, o sea, tendríamos el instructor dando el contenido y podemos brincar al próximo slide para seguir explicándole. El instructor estaría hablando y la información estaría siendo procesada real time, donde el que sería ¿verdad? La persona hearing impaired tendría la capacidad de poder leer lo que estaría ya siendo presentado, el material que está siendo presentado. Próximo slide, por favor. Uno de los, se me quedó el otro slide, uno de los new features que vamos a estar trabajando sería, además del closed caption, sería incluir los signs language. Próximo slide, estaría Edwin Martínez continuando.
Saludos a todos. Este diagrama que pueden ver es el core de nuestra aplicación. Lo intentamos de forma, ¿verdad?, que pueda ser inclusive modularizada, donde todo el contenido educacional sea a través de creación de workshops, how-tos o assignments, ¿verdad?, para estudiantes, donde todo este contenido es alimentado a una plataforma educacional que en este caso estamos, ¿verdad?, quisiéramos trabajar con el Departamento de Educación para hacer el correspondiente plugin, como diríamos, un tipo Lego de conectar esta plataforma con ellos para que ellos puedan utilizarla y poder alcanzar esa población de estudiantes que ha tenido diferentes tropiezos durante esta pandemia. En el caso de Teams, que no han tenido ¿cómo se diría? Se me fue la palabra. Ok, no han tenido un training especial, ¿verdad?, de cómo se utiliza la plataforma. Y como podemos ver, pues la plataforma tiene dos opciones de standalone para comunidades que no tienen acceso al Internet y el web-based app para, ¿verdad?, áreas donde hay conexión. Estamos trabajando especialmente con los accessibility features, o sea, closed captions, lenguaje de señas y el color formatting, ¿verdad?, para estudiantes o profesionales que tienen problemas con la visión y con los colores. Las interfaces van a estar, ¿verdad?, van a tener cierto tipo de configuración, ¿verdad?, dependiendo del caso de cada estudiante. Ok, próximo, por favor. A largo plazo, ¿verdad?, esta aplicación queremos expandirla, ¿verdad?, para poder ir agregando diferentes tipos de impedimentos y deshabilidades, ¿verdad?, para que no todas las personas que queremos alcanzar en Puerto Rico, los estudiantes y profesionales, pues puedan utilizar una plataforma única e inclusive y que no se sientan que son algo aparte, sino que son personas como tú y como yo, o sea, que pueden hacerlo todo como nosotros lo hacemos también. Próximo, por favor.
Ok, en la sección de competition, pues, ¿verdad? Nosotros
You're
no...
at time, please conclude.
Ok, no competition whatsoever. Next slide. Edwin.
Toda es la información que conseguimos de estadística. Gracias a todos.
Bueno, muchísimas gracias por esta presentación interesante. ¿Hay alguna pregunta de los jueces?
Sí, saludos. Excelente presentación, equipo Siembra y Cosecha. Tengo una pregunta sobre cuál es su estrategia para identificar instituciones u organizaciones y o instructores para implementar dicha plataforma dentro de su currículo, para entrenar a nuevos empleados o inclusive educar a los estudiantes.
Ok. Podemos identificar al instituto, ¿verdad?, de Hearing Impairment de Puerto Rico, que ellos también se encargan de a enseñar a personas, ¿verdad? El lenguaje de señas. Lamentablemente en Puerto Rico no hay muchas personas con ese conocimiento, que ellos nos podrían dar una gran ayuda en el contenido. También como la organización de CEL de Puerto Rico, que ya tiene, podríamos decir, un directorio donde podríamos tener información adicional sobre los estudiantes, ¿verdad? Y toda aquella entidad que tenga relación a este grupo de personas es de gran ayuda para nosotros poder alimentar la plataforma y proveer las herramientas correspondientes y de fácil acceso y utilizables para este sector poblacional.
Gracias.
De mi lado yo solo tengo... Sí, hola, Jennifer por acá. De mi lado yo solo tengo un comentario. El Departamento de Educación, ¿verdad?, para la división de todo lo que es personas con impedimentos, ya tiene un contenido inclusive que se ha venido elaborando. Quizás una idea sería poderse reunir con ellos y, bueno, a través de la plataforma que ustedes proponen, ¿verdad?, link ese contenido para que entonces pueda ser, ¿verdad?, suministrado, ya que hay ya desarrollado bastante de contenido en la División de Educación Especial allá en Educación.
Sería súper.
Mi pregunta es, ¿cuál sería el link entre el renglón offline y el online? Se supone que, ¿sabes? ¿Ustedes lo piensan que trabajaría juntos o trabajaría como que independientemente de uno de cada uno? ¿Cómo sería la relación entre los dos fases o lo que sea?
Sí, sería... Ok, dale, Gaby.
No, Benjamin.
Ok, básicamente serían dos plataformas trabajando paralelas, con el mismo propósito, simplemente que la plataforma que se instala en los desktops o los tablets sería una versión que está given, entonces el usuario tendría que accesar, en el momento que pudiera tener un servidor cerca, pues estaría haciendo el download de nuevos módulos que tuvieran ya el contenido que le hiciera falta. En el caso de los que son web-based, pues tendría una interacción, ¿verdad? Updated real time. Sería, ¿verdad?, para contestar tu pregunta, serían dos plataformas trabajando paralelas con el mismo propósito, entrelazadas, pero no es la misma que simplemente se divida. ¿Claro? ¿Alguna otra pregunta?
Tenemos tiempo por una pregunta más si alguien tiene otro comentario. Bueno, pues equipo Siembra y Cosecha, muchísimas gracias por esta presentación. Ahora vamos a ir al equipo de Big College Bros. If we can head to the slide for Big College Bros, please feel free to get started whenever you're ready.
Muy buenas tardes, nosotros somos el equipo Big College Bros. Próximo, por favor. El proceso de la escuela superior a la universidad puede ser uno muy complejo. Esta experiencia se supone que sea muy emotiva y de mucho aprendizaje. Sin embargo, para muchos estudiantes puertorriqueños es un poco estresante, hay mucho espacio de incertidumbre. Esto es debido muchas veces a que el estudiante no conoce qué recursos hay aquí en Puerto Rico, tales como becas que cualifican y otras universidades que también están aquí en Puerto Rico, pero no son muy conocidas. Muchos estudiantes están entre universidades y no todos reciben la misma mentoría, ya sea de consultas de consejeros o de universidades específicas. Y encima de todo esto, los estudiantes puertorriqueños han pasado por varias situaciones atípicas. Próximo, por favor.
En relación a nuestro contexto educativo actual, en el país se ha observado como desde hace 8 años la matrícula general ha disminuido significativamente y la siguiente gráfica, junto a otros datos, nos da una visión más clara de este fenómeno. Siguiente. Además, también tenemos que sumar los fenómenos que nos presentan, pues los aspectos de los terremotos y el fenómeno, ¿verdad?, la pandemia del COVID. Durante este fin de semana recogimos testimonios de 3 estudiantes de escuela superior que están en este proceso de transición hacia la universidad y todos han concluido que ha sido un proceso bien retante.
Así que, ¿cómo nosotros pretendemos resolver este problema de la poca accesibilidad a la información? Pues nosotros les proponemos una plataforma llamada Tu Pana en la Uni. El punto de esta plataforma es que los estudiantes tengan toda la información que necesitan para tomar la decisión sobre qué hacer después de graduarse de escuela superior en un mismo lugar, que no tengan que estar yendo a diferentes recursos para conseguir esta información y no se les pierda nada. Aquí tendremos explicaciones sobre cómo funciona el proceso de la solicitud, sobre cómo funciona la ayuda financiera, cómo conseguirla, cómo cubrir los costos de la universidad y cómo funcionan los exámenes estandarizados y otros requisitos que necesiten los estudiantes. Se encontrará un listado de todas las instituciones postsecundarias en Puerto Rico, incluyendo universidades, escuelas técnicas o otras instituciones que no cubran en cualquiera de esas dos categorías. Esto le dará a los estudiantes un listado lleno de estadísticas en las que van a poder comparar objetivamente una institución a la otra con los criterios que les importen a ellos. Y al no estar atado a ninguna universidad en específico, no estamos impulsando una institución en particular. También tendrá un catálogo de becas que apliquen a estudiantes puertorriqueños, porque muchas becas a lo mejor no cubren todos los requisitos que nosotros necesitamos y tendrá un sistema de tags para poder filtrarlas según el estudiante. También estará la opción, también estará la opción de que otros estudiantes voluntarios estén uno a uno con un estudiante que necesite más ayuda, más información sobre alguna universidad. Y ¿cómo esto nos ayudará? Entonces, incrementaría la cantidad de estudiantes ingresando a escuela postsecundaria, ya que van a tener un mejor entendimiento de cómo funciona el proceso y cómo cubrir los gastos y cómo hacerlo de manera correcta y estarían más seguros haciéndolo. También le daría oportunidad a instituciones pequeñas a que sean conocidas, a que le salgan a la luz, como Holberton, que está con nosotros aquí en el Ideathon. Esto disminuiría también la cantidad de estudiantes que emigrarían para estudiar y también disminuiría la cantidad de trabajadores que estaríamos perdiendo, ya que si no salieron a estudiar, es menos probable de que salgan a trabajar después de graduarse. Próximo. Esto pues, es relevante a Puerto Rico, ya que no existe ningún sistema que aglomere estas instituciones que sean puertorriqueñas. Existen unas competencias como College Vine o Big Future, pero ninguna de estas cubre el área de Puerto Rico. Próximo. Para cubrir la plataforma, estaremos cobrando una cuota pequeña a cada institución, pero como seríamos sin fines de lucro, no sería muy alta, así para que no hubiera ningún impedimento con las instituciones pequeñas y poder tener información de todas las instituciones como queremos. Próximo. En un futuro se podría añadir, queremos un capítulo en cada universidad, en cada institución, para tener voluntarios de cada una. Y añadir opciones para estudiantes que estén al momento en la universidad o que se estén graduando de internado o más de estudio. Próximo. Este sería nuestro equipo. Esperemos que les haya interesado.
Muchísimas gracias, equipo Big College Bros. ¿Alguna pregunta de los jueces?
Tengo una pregunta. Excelente trabajo, Big College Bros. Me hubiese querido tener un pana, me hubiese gustado tener un pana en la uni también. Mi pregunta va más a cómo van a asegurarse que esta plataforma llegue a todas las escuelas, porque verdad estás hablando de que van a tener que pagar un fee aunque sea pequeño, algunas escuelas pues no van a poder hacerlo. ¿Cómo vas a bregar con las escuelas públicas versus privadas? ¿Cómo vas a hacer que esta aplicación llegue a la mayor cantidad de jóvenes para que se beneficien de ella?
Pues estamos pensando ir principalmente directo a las universidades, por las universidades públicas, pues estamos pensando la cuota de las universidades privadas, pero al ser tan pequeña se podría hacer para alguna información en específico. Que por ejemplo, si una universidad no paga la cuota, se podría mencionar, pero no tener toda la información que necesitaría. Así que la incentivaría a pagar la cuota para tener esa información y al ser un pago tan pequeño, pues no sería un problema mayor.
También quiero añadir que esto se le costearía a las universidades, que ellos ya tienen un presupuesto para la publicidad. Por ejemplo, en la UPR vimos en unos datos que ellos utilizaron $161,000 para el año 2019 y también no queremos cobrarle a ninguna escuela per se.
Saludos. Excelente presentación. Tengo unas cuantas preguntas, al igual que mi colega Héctor. Yo quisiera también, en mis tiempos pasados, tener un panel en la uni. Tengo unas cuantas preguntas. La primera sería, ¿cómo ustedes van a curar la información de lo que ustedes consideran necesario para conocer mejor la universidad y poder compararlos? ¿Qué parámetros están utilizando? Lo segundo es desde cuándo van a promover esta plataforma para los estudiantes de Puerto Rico conocer de las instituciones, porque muchas universidades ya uno tiene que considerar los requisitos mucho antes de solicitar a estos programas. La tercera sería en qué utilizarían el dinero que están recibiendo, dado que van a hacer non-profit, si consideran utilizarlos para becas para los mismos estudiantes que utilizan sus plataformas, o si lo están planificando para el maintenance de la plataforma per se. Y la última pregunta, que es más como un comentario, si ustedes han considerado, dado que están pidiéndole a estas universidades públicas y privadas que compartan información en su plataforma, tener representantes de dichas instituciones para poder comunicarse si tienen preguntas a sus usuarios respecto a sus programas, o si piensan utilizar webinars para que los estudiantes conozcan mejor de su plataforma, o inclusive voluntarios o estudiantes orientadores en estas instituciones para poder mejor comunicar los recursos que hay y por qué deben de considerar esta institución al momento de solicitar. Sé que fueron varias preguntas.
Sí, intentaré contestar y recopilar algo de las preguntas. El propósito de esta plataforma también es reunir, además de toda la información, es un puente, intentamos construir un puente más seguro entre las universidades, las instituciones universitarias, a las escuelas, y que las escuelas ni los estudiantes tengan que recurrir a otros recursos para poder pagar el uso de esta plataforma. Por eso recurrimos a fees a las universidades. Esperamos una colaboración, unos acuerdos en donde, ¿verdad?, futuramente se pudiese organizar capitulaciones que representen las universidades, ya sea la administración, que organicen asociaciones dentro de las universidades, ya que sean estudiantes voluntariados también dentro de las universidades. Sabemos cómo van estudiantes de escuela superior a open houses y en universidades asignan mentores de la universidad. Quisiéramos formar una plataforma donde se pudiese conectar todos estos mentores de las universidades representando cada una para conectar, ya sea de una manera un poco más personal, mediante chat, también puede ser mediante chat para conectarlo a los escuelas superiores, para que darle ese feedback más personal en cuestión de más colaboración con la universidad. Pues también deberíamos utilizar la oportunidad con la conexión con ellos para promocionar la página dentro de la universidad, ya que ellos también podrían formar asociaciones de acuerdo a la forma para promoverla. Y nada, lo que buscamos es formar un puente donde se haga más fácil a esa transición a los estudiantes de escuela superior a la universidad, y que sea una plataforma donde puedan accesar más a la información, las becas, orientaciones sobre presupuesto, cómo pagar la universidad, el acceso a becas. En cuanto a la información, cada universidad tiene en su plataforma la información de qué son los requirements que necesita cada estudiante para ingresar. De esa manera, cuando se supla esa información a la plataforma, se puede comparar cada universidad de acuerdo a las variables que consideren importantes, el costo de la universidad, si tienen hospedajes de la universidad, las clases, en cuestión de los créditos, los libros y ese tipo de factores.
Y en la pregunta de para qué estaríamos usando el dinero, se estaría utilizando para el mantenimiento de la página y para añadirle otros features o algunos detalles que podríamos mejorar poco a poco, pero que no sería un ingreso de ninguna manera.
También futuramente, si eso se puede... disculpe.
Bueno, muchísimas gracias por estas preguntas y respuestas, pero ya es la hora para ir a la próxima pitch. Muchísimas gracias a todos. We can now head on to Beyond Learning. Team Beyond Learning, please feel free to start whenever you're ready.
Hi, okay, so give us 5 seconds while we like grab our notes and everything.
Okay.
So let me.
¿Me veo? ¿Me escucha?
Te escucho, no te veo.
Ok.
Adriana no te ve. Ahora.
Ok. Ahora. Dame un segundo para bajar las cortinas. Aquí.
Por favor, empieza cuando están listos.
Gracias.
Ahí estamos. Ya estamos listos. Pues buenas tardes a todos. Mi nombre es Adriana Dávila, mi compañero es Javier Santiago y nuestro equipo se compone de 3. Gabriela Santiago no estaba presente con nosotros porque está trabajando en la feria de vacunación del COVID este fin de semana. Pero sí, pues trabajo en la idea del proyecto. Próximo slide, por favor. Pues la situación actual es que el COVID ha creado un problema bien grande en el sistema de educación que ha afectado a millones de estudiantes. Esta crisis ha sacado a reducir problemas de educación que ya existían y ha reducido las oportunidades para estudiantes de minorías para que puedan seguir estudiando. Esta emergencia pues ha cerrado la posibilidad de que el estudiante y el maestro se vean cara a cara en un salón de clase y no tenemos garantías de que el estudiante adquiera la información necesaria para continuar con su proceso de desarrollo académico y que tenga esa información a tiempo y que tenga la oportunidad de hacer planes con tiempo para su futuro. La educación online eliminó el human interaction y la manera en la que un consejero se sienta pues semanalmente a pensar qué va a hacer ese estudiante día a día. Por ejemplo, yo cuando estaba en la escuela, una vez al mes, me reunía con mi consejero presencialmente y esa persona se sentaba y discutía conmigo qué yo quiero hacer en la universidad. Nosotros lo que queremos es hacer una página. Ahí próximo. Las necesidades que queremos cubrir es que nosotros queremos una plataforma para los estudiantes puertorriqueños, maestros y consejeros, donde puedan buscar información que es importante para planificar el futuro de sus estudiantes y además de esto, promover un estilo de vida saludable durante la pandemia. Próximo, por favor. Javier, por favor.
Sí, nuestra idea es básicamente crear una plataforma que los consejeros puedan administrar o ayudar a los estudiantes, que también sea independiente para los estudiantes si los consejeros no tienen la oportunidad de trabajar con ellos, ¿verdad? Porque en mi caso yo no tuve la mejor consejera y realmente sé que ella estaba sumamente sobrecargada con todos los estudiantes que tenía. Y sé que obviamente teniendo una plataforma que la hubiera ayudado a ella mejorar lo que sería el contacto conmigo, tener el contacto con todos los estudiantes, hubiese sido una tremenda idea porque lo hubiese ayudado a abrirme más las puertas y mejorar mi visión hacia todo lo que podría haber hecho cuando estaba en la high school, ¿verdad? Y nuestra idea es básicamente crear esa plataforma para los consejeros, para que no solamente los estudiantes puedan tener acceso a lo que son recursos, encontrar su propio camino, pero que los consejeros los puedan guiar, le puedan decir, mira, está esta universidad, está estas opciones, puedes ir aquí. También queremos abrir el camino para que los estudiantes puedan encontrar consejos de cómo bregar, obviamente, en lo que sería esta situación de la pandemia, porque no es lo mismo estar todo el día detrás de una computadora a estar todo el día en un salón. Es una diferencia bien grande y a través de eso quisiéramos también trabajar con las universidades para poder crear lo que serían tours virtuales, ya que esa opción se perdió debido a lo que es el COVID, abrir las oportunidades para los que estudiantes puedan ver lo que son becas, oportunidades como sea campamentos de verano, opciones que realmente solamente se abren para los estudiantes de high school, que no siempre son lo mejor promovido, perdón. Y realmente la idea detrás de todo esto es crear una ayuda antes de lo que sería la universidad para que tú no entres ciego. Porque yo entré a ciega y realmente cogí 4 cantazos, 4 caídas y fue una experiencia bien increíble y aprendí mucho, pero quisiera haberlo evitado. Próximo, por favor.
Esta es la página que nosotros pensamos, esta es más o menos un sketch de lo que nosotros pensamos que fuera la página. Nosotros queríamos enseñar carreras, profesiones, y queríamos enseñar las oportunidades de becas que tienen los estudiantes puertorriqueños. Además, que tenemos un área completa diseñada solamente para estilo de vida. Ahí queremos dar tips de cómo manejar el estrés de entrar a la universidad, cómo manejar la carga académica, tips para estudiar eficientemente y todo lo que tenga que ver con tener un estilo de vida saludable y una preparación mental para entrar a lo que sería la universidad. Además de eso, queremos poner un tab completo para universidades, pero las universidades van a ser solamente locales. Nosotros queremos que nuestras universidades en Puerto Rico tengan la oportunidad de enseñar sus programas, su universidad de manera virtual, que ellos pongan a disposición sus consejeros para que los estudiantes puedan tener una comunicación 1 a 1 con la universidad que ellos quieren y tengan todo listo para entrar a la universidad con todas las oportunidades que esa universidad le puede ofrecer. Próximo, por favor.
Por favor, concluyan pronto, ya están a tiempo.
Okay. Pues nuestro mercado meta sería lo que serían estudiantes de high school, perdón, y lo que serían maestros y consejeros. Próximo, por favor. Y
nuestra competencia son las grandes páginas como fuera Universia y otro tipo de blogs que tienen la información, pero no está actualizada. Lo que nosotros ofrecemos es una información actualizada en qué ha pasado con el COVID, que todo ha cambiado, todas las modalidades han cambiado. Pues nosotros le queremos decir, esta es la información que tú necesitas, aquí está y nosotros te la queremos dar. Próximo, por favor.
Por favor, concluyan ya se pasó el tiempo. No.
Ok, pues está.
Muchísimas gracias al equipo Beyond Learning por esta presentación. Ahora tenemos una pregunta de los jueces.
Mi pregunta, ¿los consejeros que trabajarían a través de esta plataforma serían consejeros que ya están trabajando en las escuelas o sería cualquier persona que quiera ser consejero podría venir y ayudar a los estudiantes? O ¿cómo sería ese proceso de convertirse en consejero a través de esta plataforma? ¿Y han pensado sobre cómo sería el proceso de vetar a esas personas para asegurarse que tienen la preparación adecuada para poder hacer ese tipo de trabajo?
Pues realmente habíamos considerado que obviamente no todo el mundo debe tener la opción de trabajar con esta plataforma. So, pensamos que la mejor opción sería dárselo a los consejeros que ya están trabajando en lo que sean, me iba a decir universidades, perdón, en las escuelas superiores, porque ya esta plataforma en la realidad es una ayuda. Es una mejor manera de organizar todo el trabajo que ya tienen que hacer, pero centralizarlo en una área para que realmente se le haga mucho más fácil el trabajo de poder mover los estudiantes de punto A a punto B.
Tengo una pregunta para darle seguimiento. Dado que están mencionando, pues que entonces se enfocarían en proveerle la plataforma a consejeros ya existentes, ¿cómo ustedes van a suplementar y permitir el uso de su plataforma a instituciones o escuelas que no tienen consejeros dentro de su grupo de profesionales?
Pues realmente lo habíamos considerado y lo empezamos a pensar. No tengo una respuesta concisa, completamente desarrollada, pero ahí fue cuando empezó la idea, actually, de como dijo Roberto, que de personas exteriores, empezamos a pensar cómo podíamos evaluar lo que son las personas exteriores, y aunque me voy a hacer una redundancia y contradecir un poco, pero otra opción que también se había considerado era coger personas que realmente ya hayan pasado por lo que sería el proceso de universidad, ¿verdad? En Puerto Rico, y fuera de lo que sería lo local y la parte local interna, ¿verdad? Y tratar de abrir y preguntarles, mira, ¿y cómo tú hiciste tal parte? Porque obviamente los tiempos cambian, las décadas cambian y los procesos cambian, todo cambia con el tiempo, pero sí podríamos conseguir personas que obviamente ya sepan un conocimiento un poco más avanzado. Por ejemplo, conozco trabajadores sociales que se han retirado, hacen las cosas por orgullo y felicidad de cómo hacen su trabajo. Sé que las personas que ya han salido del campo les encantaría trabajar con un proyecto así, tratando de liderar a personas que realmente están todavía en su desarrollo, ¿verdad?
Gracias. ¿Hay otro comentario o pregunta? Tenemos un minuto más.
Sí, yo tengo una pregunta por acá. No sé si han pensado en definir los posibles KPI para medir el éxito de la plataforma. O sea, ¿tienes algunos KPI que han elaborado para saber si en efecto, o sea, medir ese éxito? ¿Cómo lo van a medir?
Pues para medir, debido a que obviamente se tiene que hacer, bueno, no digo obviamente, pero en lo que sería la parte técnica interna de ya lo que es la parte de infraestructura, pues se tiene que trabajar lo que sería la parte de logs, y a través de los logs nosotros tenemos que obviamente medir si la plataforma está funcionando a través de diferentes métricas, por ejemplo, lo que sería estudiantes aceptados, si los estudiantes realmente se sienten bien con la plataforma, que ya tomaría lo que serían entrevistas pequeñas, como por ejemplo, ¿te sientes bien? ¿Cómo has estado en la pandemia? Que son cosas que, por ejemplo, se encuentran también en lo que serían plataformas como Facebook, Instagram, que de repente te dicen, ha sido elegido para una pequeña entrevista, y realmente al ser anónima, pues se le da la oportunidad a que el estudiante sea libre de expresión, y la misma parte para los consejeros, y realmente damos la opción también para que los estudiantes puedan dar quejas de la misma parte de los consejeros, y realmente quisiéramos poder medir si cada estudiante realmente está entrando a las universidades que quiere, si están encontrando su camino, porque al fin y al cabo, si nosotros no conseguimos que cada estudiante esté feliz con el camino que escogieron, o realmente diga, wow, esto es lo que yo quería hacer, pues estamos fallando. Y a lo mejor habrá un cambio a mitad de camino, pero si tuvimos una perspectiva de que lo llevamos a mejorar, a llegar a ese cambio completo, sería perfecto.
Bueno, muchísimas gracias a todos por esta conversación. Ahora vamos a ir al próximo equipo, Team Phoenix. Ustedes pueden empezar cuando quieran. Gracias.
Gracias. After a year of the transition to virtual learning due to the COVID-19 pandemic, we have started to see the many effects remote teaching has had on the Puerto Rican student community and in schools worldwide. The Phoenix team is compromised with providing solutions for educational reformation and giving rise to a new education system. Next slide, please. We are a group of 3 motivated individuals who are concerned with the current educational system, but truly believe we can transform it into a successful and resilient one. Next slide, please. Our team identified the overall problem in the current remote learning system by conducting a survey in the private and public sectors of Puerto Rico. We observed the following trends. 1, students and teachers were used to learn too many virtual programs simultaneously. 2, an absence of a central medium for communication between the academic community. 3, a lack of technical support where no follow-up was made after technological trainings, and in some cases, trainings were not even offered to the academic community. And 4th, a need for guidance for teachers, students, and parents to use existing technological tools for the best teaching and learning experience.
After evaluating interviews made to the academic community and reading detailed research about the COVID-19 educational transition, we have determined that the needed tools for a successful educational reform are already here. Next slide, please. What is needed is to effectively unify all virtual educational activities into a single platform that all educational institutions in Puerto Rico can utilize. Next slide, please. The strategy we offer is founded in these three critical principles: 1, standardization; 2, execution; and 3, empowerment. Next slide, please. Standardization. We aim to establish a single, unified technological solution for our educational platform. Currently, the Puerto Rican Department of Education has implemented the Microsoft 365 education program. We would like to standardize this technological system so that all of our students and teachers are using Microsoft tools to the fullest. Next slide, please. Execution. We will design an effective transitioning plan that every school can use to adhere to this new operating system. This includes creating a new support department, which will be in charge of providing continuous technical support to its users. We will also facilitate a plan for the training of teachers, students, and parents that includes a follow-up component where proficiency of Microsoft technological tools will be validated. Next slide, please. And finally, empowerment. This principle is our most valuable. Both students and teachers will be guided so they can master the current technologies and improve their experience in a virtual learning setting. Since involvement will be open to all members of the academic community, including parents and directors, all in a single technological platform, schools will be able to track student performance and student success. Moreover, students with special needs and specific educational deficiencies will be easily identified using one system. Teachers will then be able to cater to their students' needs with the technological resources they learn through the trainings. Next slide, please. We will start implementing our solution using a model school. We believe that a school such as the one shown in the slide, with poor ratings and low academic stats, can raise their numbers by implementing our solution of a uniform technological platform. This school will make headway for the rest of the schools in the Puerto Rican educational system, including public and private schools, nonprofit organizations, as well as the University of Puerto Rico. Finally, the strategy that we propose can even be applicable to other academic and business institutions. Next slide, please. Unifying our technological tools is the key for having an efficient framework for a successful community, and it will help us transform the current disruptive system into an uninterrupted learning experience. Furthermore, the technological skills the student acquires will be easily transferable to all stages of their educational and professional journey. This is how we will improve our current educational system. And next slide, please. This is how together we will rise. Thank you.
Thank you so much for this great presentation. We'll now open it up to the judges if you have any questions.
So, oh, sorry, go ahead.
Oh, you can go ahead.
I just wanted to check. So I just to make sure that I understood. So would this work within the existing structures of the Department of Education, or would it be kind of outside of it as a service provided to the department? Because you kind of talked about creating a like a support unit or something, and I just want to make sure that I understand where you're based out of.
Yes, the system that the Department of Education currently has that they implemented during the pandemic is Microsoft 365. And we, as an alliance, will make sure that the technical trainings will be performed so that teachers and students and parents have the technical support. But the program is actually already licensed in the Department of Education, but most teachers, most students, and most parents don't know how to manage it and don't know the many tools that it offers.
So then you would be partnering with the Department of Education to help provide that support.
That is correct, yes.
Okay. Mm-hmm.
Hi. Great presentation. My question goes towards kind of that support that you will be providing the Department of Education in terms of who will be providing this continued technical support? Like, how are you vetting your team members? Who are they? What background do they have? And then on top of that, how can you make sure that Office 365 is able to meet all of the instructors' courses needs? Because you're talking about a varied range of courses, from more technologically savvy courses like sciences to more like ingrained needs of music and physical education. Like, how can you make sure that your team is equipped to be able to meet the needs of the instructors and of those courses?
Yes, of course. I would like to bring forth my team, Valerie and Antonio. They can actually answer all of your questions.
Yes, I will switch to Spanish, if you don't mind. Buenas tardes, primero que nada. Bueno, pues les comentamos, ahora mismo nosotros escogimos la plataforma Microsoft 365, ya que como la compañera comentó, ya el Departamento de Educación la tiene fully integrated a todos sus cursos. Lo que acaban de preguntar, todas las herramientas que posee Microsoft 365, por ejemplo, tienen habilitados áreas para, por ejemplo, apoyar al área de música, el área de matemáticas. Inclusive ya existen herramientas creadas para que los maestros de matemática puedan crear una pizarra virtual y poder mostrar, hacer exámenes, etcétera. Lo que nosotros sí encontramos es que ahora mismo la mayoría de esos profesores no saben utilizar estas herramientas. O sea que por eso nosotros no estamos proponiendo crear algo nuevo si ya tienen algo existente. Segundo, nuestra proposición es con ayuda de Microsoft, ya que nosotros estuvimos en comunicación con ellos nos dejaron saber que si ahora mismo esta escuela en específico necesitara adiestramiento, ellos los pueden brindar de manera gratuita. Nosotros nos encargaríamos de apoyarlos a ellos como un hub para poder crear los schedules, etcétera, para poder brindarle, ¿verdad?, toda esa necesidad que necesitan estas escuelas.
Sí, yo quisiera añadir a eso, como estudiante, lo que usted menciona, ¿verdad?, de la diferencia de clases, pues eso es lo que yo he sufrido, ¿verdad?, porque durante esta pandemia he tomado clases y yo tomo clases de ciencia, clases de humanidades, pero la herramienta de Microsoft Teams tiene todas las capacidades de hacer cualquier cosa, y hemos visto success stories de escuelas implementándolo en sus clases de educación física, en sus clases de música, porque tienen herramientas de Artificial Intelligence, herramientas de monitoreo de movimiento corporal para los maestros de educación física. Tienen herramientas para estudiantes con discapacidades, estudiantes ciegos, estudiantes sordos. Así que en realidad el problema está en que no se conocen de esas herramientas y no hay entrenamiento de esos profesores para utilizarlas. Pero nosotros estamos confiados de que la herramienta que hay actualmente de Microsoft pudiese cumplir con las necesidades de cualquier tipo de curso y de cualquier tipo de profesor y estudiante. ¿Hay algún aspecto de su pregunta que se nos olvidó contestar, Paola?
Sí.
No, gracias. Tenía la curiosidad sobre cómo pensaban preparar a su equipo de apoyo tecnológico y capacitarlos a ellos, pero como mencionaron que ustedes utilizarían ya de por sí al de Microsoft y ustedes servirían como esencialmente un puente para poder facilitar esas conversaciones y esos entrenamientos, creo que me contestaron las preguntas. Gracias.
Gracias. ¿Alguna otra pregunta?
Mi pregunta es sobre el Model School, ese slide. ¿Puedes explicar un poco más qué sería eso y en los ratings? Especialmente estoy curioso sobre qué ese rating completo viene de esas 6 metrics que están a la izquierda o algo más, ¿qué más iría a ese rating? Sí.
Sí, o sea, este rating que mostramos en el slide es el rating actual del Departamento de Educación sobre ciertas características de esa escuela. Cogimos una escuela que tiene poca asistencia, poco matrícula y poca tasa de graduación. Y lo tenemos como ejemplo para empezar con escuelas que tengan estas dificultades y utilizarlas como escuelas modelos para nuestro sistema. Y entendemos que cuando lo ayudemos a integrar todas las herramientas tecnológicas, estos ratings sí van a aumentar y lo podemos tener en constante monitoreo. Pero Microsoft, a su vez, también tiene una herramienta para estar monitoreando estadísticas y ver el rendimiento del estudiante y el mejoramiento en sus tareas y en otras características de lo que es el curso y de la escuela en general. No sé si alguno de mis otros compañeros quiere abundar sobre eso.
Y lo importante es que todas estas herramientas, como les mencionamos al principio, no va a tener ningún tipo de costo para ningún tipo de institución, ¿verdad? Pública, ya que todo está en las licencias que se le ha provisto tanto a los maestros y a los estudiantes. El caso aquí es poderlo implementar y poderle sacar provecho.
Una pregunta solamente para clarificar que estas estadísticas son de una escuela que utiliza actualmente Office 365, ¿cierto?
Como nosotros... Ajá.
No, sí, puedes proceder.
Ok, pues como mencionamos, el Departamento de Educación tiene Office 365 a todas las escuelas de Puerto Rico. Se supone que sí, esta escuela esté implementando el uso de Office 365, pero como hemos visto, las escuelas ahora, los profesores utilizan diferentes herramientas, lo que tengan más accesible, lo que ellos conozcan, como Zoom, Google Meet. Pero la propuesta es que cuando nosotros implementamos por completo y integramos todo el programa de Microsoft 365, estas estadísticas sí van a mejorar. Eso es lo que proponemos.
Sí, vamos a poder probarlo porque como todas estas herramientas, después que estén unificadas, nos van a proveer datos en tiempo real de lo que necesitamos saber, pues al momento inclusive nosotros podemos saber si tenemos varias escuelas. Por ejemplo, vamos a poder ver un trending de manera, ¿verdad?, visual. Mira, esta escuela, por ejemplo, está teniendo problemas con el inglés y podemos atacar esta situación mucho antes que nos digan a final de semestre, mira, se colgaron 5 estudiantes cuando pudimos haberlo salvado a mitad de semestre, etcétera. Esa es nuestra visión de esta implementación.
Sí, y no sé si tenemos un último tiempo, pero yo diría que también, hemos hablado de esta herramienta en la educación virtual, especialmente ahora en los tiempos de COVID, pero en nuestros success stories, las escuelas han logrado implementar esta herramienta de Microsoft y utilizarla en clases presenciales, donde los estudiantes se llevan sus dispositivos a las clases, se los llevan a las casas, lo utilizan constantemente e indican en algunos casos que prefieren ese tipo de educación virtual, que prefieren toda la dinámica que se da con la educación virtual cuando está completamente integrada.
Bueno, muchísimas gracias a todos. Your presentation was really interesting, as were the presentations of all education track and honestly all of the presentations and the other tracks we saw today. I want to say a huge thank you to each of the teams for spending so much time putting these great pitches and ideas together, and also a huge thank you to the judges for all of the really engaging questions that helped us dive deeper into these ideas. To each of the judges, to the education track judges, I will send in the Slack group a link to a breakout room so we can discuss our ratings and move forward. And to everyone else, I look forward to seeing you in about an hour at the closing ceremony. Thank you.
Well, that is the conclusion of the Puerto Rico COVID Ideathon pitches for the education track. And for that point, for all of the tracks in the Puerto Rico COVID Ideathon, we want to really thank you again, all of the judges across all of the 3 tracks. We are honestly very, very grateful for your time. We know it's a long weekend and you guys are taking the time out of your busy schedules as the leaders in the industries that you are. So a big thank you from the Puerto Rico COVID Ideathon Planning Committee. And to all our viewers that are catching up to the live stream, thank you so much for checking out all of these amazing pitches. We really wanted the opportunity to share what was going on throughout the weekend with you all, with the world really. So muchas gracias a todos that are watching us right now. And yes, next slide, please. ooh, this can't be left behind. So huge thank you to all of the teams that worked throughout this weekend. We are very proud of all of your work. All of your tracks leads have said it eloquently. We're super proud of all of your hard work, determination, all of the research that you've put into this, all of the ideation. Really, we like take our hats off as the planning committee to tell you that we're very proud of you and very thankful that you chose to take the time out of your weekend. It's also a long weekend for many of you, so we're very thankful for to coming all the way throughout these 48 hours and just meeting with your teams and building the pitches that we've now just witnessed. We also want to take a chance to thank all of our sponsors that have made this event possible. And so here you see a picture. We're honestly very lucky to have the support of the organizations that you see here. Many of them have been involved in many different ways to help this bring this event to light. And we're just very lucky as an organization, as from the planning committee side, to have these. So please take a chance to do your research on one of these organizations. They're all committed to helping Puerto Rico beat COVID. But we're not finished yet. Stay tuned for the awards in 1 hour. We still have a round of judges to go through and to go through the deliberation process.